Good morning, everybody. Thank you for being here. All our speakers and online in virtual land, we appreciate you coming here. We had a nice snowy surprise last night. It was actually nice to have some moisture. But anyhow, thank you all for joining us today. We've got a fabulous program planned for the day. So welcome to the third conference of the year for the NAU Center of Health Equity Research, our Arizona Biomedical Research Center Education Series conferences. My name's Steve Palmer, and I'm a professor in health sciences at Northern Arizona University. So these educational programs are supported by the Arizona Biomedical Research Center. So a big thanks to John Garcia, who I believe is participating with us online today. The first two conferences we held this year addressed, the first one was on healthcare in the workforce, and then our second was on interventions and resources for addressing substance use disorders, and just fabulous speakers and presenters at those conferences. Looking ahead, on May 13th and 14th, we are holding the 6th annual UMA conference, and this year we're looking at partnerships sustaining healthy border communities. We wrap up this year's programming on June 6th with a conference titled Looking Beyond BMI, and we are unraveling the complexities of weight, stigma, and care. So we welcome you to join us for those educational conferences as well. So today we're examining water access and quality and the healthcare response. We are fortunate to have renowned scholars and public agents here to present. We begin the day with Dr. Jani Ingram presenting research characterizing Navajo unregulated water sources. We will then hear from Hsini and Nikki Lavardi-Kosh from ADHS, who will discuss the intersection of public health and drought. Dr. Michael Charles will then discuss challenges and consequences of water access and quality. And then we're going to break for lunch. Following lunch, we have a tremendous panel that include healthcare providers and scholars to discuss bridging the gap between water injustices and health practices. So before I get started, I need to read the following disclosure per guidelines for CMEs. So the following planners, faculty, or individuals in control of content for this educational activity have relevant financial relationships with ineligible companies, and that would be none. All of the relevant financial relationships listed for these individuals have been mitigated. None of the remaining planners, faculty, or other individuals in control of content for this educational activity have relevant financial relationships to disclose with ineligible companies whose primary business is producing, marketing, selling, reselling, or distributing healthcare products used by or on patients. This activity has been planned and implemented in accordance with the accreditation requirements and policies of the Arizona Medical Association through the joint providership of Northern Arizona Healthcare and Northern Arizona University. Northern Arizona Healthcare is accredited by the ARMA to provide continuing medical education for physicians. Northern Arizona Healthcare designates this live activity for a maximum of 4 AMA PRA Category 1 credits. Physicians should only claim credit commensurate with the extent of their participation in the activity. So thank you for bearing with me on that. With that, let's get started. I'm pleased to introduce Dr. Jani Ingram. Dr. Ingram is a Regents Professor in Chemistry and Biochemistry at NAU and a member of the Navajo Nation. Her research focuses on investigating environmental contaminants with respect to their impact on health in at-risk populations, funded by NIH, NSF, and EPA. She is the principal investigator of the Partnership for Native American Cancer Prevention and the director of the Bridges to Baccalaureate program. She received a doctoral degree in chemistry from the University of Arizona, and she was a staff scientist at the Idaho National Laboratory for 12 years before joining the faculty at Northern Arizona University in 2002. So folks, please join me in welcoming Dr. Ingram.
All right. Good morning, and thank you for having me. So water is where I started with the work that I've been doing at NAU. So it's wonderful to be able to share some of the work that we've been doing. So today's talk is actually very collaborative. As you can see, there's lots of names up there. I'll talk a little bit about the work that we have been doing with the University of New Mexico and also University of Arizona. and just some of the former students that I have that now are leaders in this area. So, and a few of them you'll get to see in the panel later today. So before we get started though, for those of you not here or those of you visiting, so welcome to Flagstaff. And I just wanted to, just be cognizant and really we are blessed to be at the base of the peaks, which are sacred to many of the Native American tribes in northern Arizona. So we just thank them for the opportunity to be here. And, the peaks are beautiful right now because they got some recent snow. So before I start, I just want to give you a little bit of background about who I am. So I'm going to introduce myself in the Navajo language. Yate abane, she Jani ingromunishe, na ana steji tichini nishle, bilagana basis chin, kidlachini dashes che, bilagana dashes nale. So what I said was that I am Navajo on my mom's side or from the Dene. And so the clans are really my grandmother, who's shown in the picture there along with my mom, is the charcoal streak clan. So I always think about it like football players with the charcoal streak. And then my grandpa was Red House. And then my dad is from, oops, how do I go backwards? Okay. My dad was born and raised actually at the south rim of the Grand Canyon. And his mother was first generation German, and then my grandpa was a European mix. So there's a picture of them. They met actually at Northern Arizona University, but it was called Arizona State College at Flagstaff. Both were teachers and lived in Kingman. So I was born and raised in Kingman off the reservation, but spent many summers with my family on the reservation over on the eastern side in Tohatchee. So in addition to being a daughter and a granddaughter, I'm also a wife and a mother. So shown there is my family, my husband James, and my kids Jordan, Josh, and Jaleesa. But in addition to having biological children, I also have chemistry children. So over the years at NAU, I think I've had more than 100 kids of varying backgrounds. So lots of Native kids, lots of non-Native kids. My youngest, I think, was a middle schooler. And then high school students, undergraduate students, graduate students from chemistry, environmental science, physics, biology, social science, sociology students. So, and they really have done the brunt of the work. So the work that we've been doing that I'm going to talk about today is on the Navajo Nation. So just to orient you a little bit, the Navajos call it the name Bikea, and it's located in the Four Corners area spanning Utah, Arizona, and New Mexico. So this is a map that shows, you can see the yellow, pink, and so forth areas. Those are called agencies within the Navajo Nation. I think about them sort of as states. And then within those states or those agencies are the chapters. So there's 110 chapters. So those are the boundaries you can see. And those are, I think about those as kind of counties. They're definitely the communities within the Navajo Nation. As you can see up there, we became a sovereign nation in 1923, which means we have our own government. And then each of those chapters have their own government. And so those are the folks that we talk to, get permission from, and work with to do the work that we do. So the community folks. And if you're not familiar, they say that Navajo is about the size of West Virginia. So I visited West Virginia, doesn't look like it at all, but you know, it gives you a little bit of a comparison. So a little bit more background. So like I said, the Navajo call ourselves Dene, and there's about almost 400,000 folks that are enrolled members, with a little less than half of those that live actually on the reservation. There's some statistics on the socioeconomic side of things. Really for this talk, a really important issue is the infrastructure. So it's estimated that 20 to 30% of the households out on Navajo do not have running water or power. So we'll talk a lot more about that as the talk goes on. And then another thing that Navajo people are sheep herders. So there is a lot of more ranching and that kind of stuff done out on the reservation. So water insecurity on the Navajo on Navajo lands really does go back to the lack of infrastructure within many of the homes. Even some of the homes that have running water still haul water because their water sources are a little difficult to say the least. And so some of the other issues that go with, some of the insecurity is the climate and drought. So things dry out. And so then wells that were dependable are now less dependable, those types of things. Also water rights within the tribal lands, but more within the state of Arizona, the state of New Mexico, because of water being such a precious commodity. And so folks haul from different types of sources. So I'm going to talk a lot about what we call non-regulated sources, which are really meant to be livestock wells. So they are not monitored, yet people are using those for their households. So just cost-wise, it typically costs, you can see up there, $600 per acre foot of water for, people in urban settings who have a tap water. For the Navajo people, it can be, about 70 times that because of having to, drive distances in order to get water. And perhaps you get there and there's a line, so maybe you decide to go somewhere else, or the water has, it's not running that day because of drought and other issues. So we'll talk a little bit about that. And then lastly, later in the talk, I'll talk about the impact to this water issue from the COVID pandemic. So shown in the picture is actually my colleague hauling water because he's from up near Monument Valley and his family needs to haul water. So these are just examples of some of these non-regulated wells. So they come in all kinds of different looks. So there's a lot of, if you go out onto Navajo, you'll see windmills in quite a few places in order to draw the water. And then with large tanks, sometimes the tanks you have to climb up somehow and get the water from the tanks. So you'll see people hauling, on their trucks, they'll have ladders, or they just climb on top of their trucks in order to get water. There's hand pumps. Some of the windmill sites have troughs, and you can put a hose onto that and get your water that way. Some of them are just tanks that you have to go to, and some of them are seep sites. So they like I said, they're all different kinds, and there's not exactly the best roads that lead to some of these wells. And so you really need to, know the lay of the land, which of course the folks that live out there definitely do. So one of the big issues as to why these unregulated wells are maybe less than desirable as far as having a place to, draw their water is the legacy uranium mining that happened out on the Navajo Nation. So now that Oppenheimer, the movie's out, people are much more aware of the Manhattan Project that, started in 1942. Anyway, as a result, there was this uranium mining boom to get the materials needed for making bombs. So it turns out that the Colorado Plateau is enriched in uranium. And so there was a lot of mining in the Four Corners area, including on the Navajo Nation. After the mining boom in about 1980-ish, the cost for uranium dropped. And so then the mining companies left, leaving behind a lot of waste. Those mines at that time were not remediated. So there were many, many mines that were just left behind. And as a result, the Navajo people, felt that this is really affecting our health. And so there began to be, people from the nation reaching out to say, this is not right type of thing. So this is a map of the Navajo Nation again. And what I'm trying to show here, all those X's are abandoned uranium mines. So there's about, Tommy can help me on this, 530, okay, 524. AUM is an abandoned uranium mine site, and then over 1,200 mine features, which means that, you know, they were perhaps going to become a mine and didn't quite get there. So you can see there's regions that show, you know, areas in the western part of Navajo, up in the northern part, that's near Monument Valley, the Four Corners area, and then down in the southeast. And so many mines not cleaned up. They were mined on the western side more with open pit mining, meaning that there was just large amounts of ore taken from the surface. Those abandoned mines really leave a very large footprint. And then more on the other side of the reservation, there was underground mining. So that meant a lot of mine shafts and that kind of stuff. So as a result, it's suspected that that's where some of the contamination to the groundwater as a consequence then to the wells was really, if it wasn't there to start with, it was made worse by the mining activity. So some of the policies that focus on this, the abandoned uranium mines are shown here. So the first one is the Superfund program from the U.S. Environmental Protection Agency. And so that was the Superfund program was started in 1980. And one issue with that is to qualify to have Superfund monies to, you know, not just mining issues, but any type of environmental issues that needed cleanup, you needed a fairly decent population density. And the Navajos, there really isn't that on the reservation except in a few sites. And so for a long time, Navajo Nation could not meet those criteria to have Superfund. But just recently up in the Four Corners area, there is going to be Superfund monies to start to clean up that area. So that's very good news. Another set of policies is the Uranium Mills Tailings Radiation Control Act, and then followed by the Uranium Mills Tailings Remedial Act action. So these were started 1978, 1981, or 1991. Honestly, lots of discussions, a lot of talk, not a lot of action. So as a result, there's only been a few mines that really have been remediated, but things seem to be, the wheels seem to be turning, not super fast, but there does seem to be more work in that area. And then the last policy actually is from the Navajo Nation, the Dene Natural Resources Protection Act, which was under the Dr. Joe Shirley administration in 2005, based on the Navajo fundamental laws saying that the Navajos do not want any more mining, no more transport of uranium ore through the nation. And that's been in effect since 2005. However, this new opening of the mine near the Grand Canyon, the Pinon, I'm trying to remember, it's not Pinon Pine, it's Pinon. Yeah, the Pinon, they're starting to mine for uranium, and the plan, and it's happening any day now. Companies have been able to overcome that. So I'm now going to focus on the work that's been done in my lab. So we have been looking at these unregulated water sources since I came to NAU, starting in 2003. And so what we have been doing is really sampling, analyzing water from many different sources, mainly based on working with the community and having them, you know, ask us or talk to us about different, mostly livestock wells in their areas that they were really interested in getting information. The other thing is having all these students from Navajo, a lot of them are like, can we test the water in my community? I'm like, well, of course we can. So I'm going to talk a little bit about that. Two of the probably most important publications on water that my group has had is the first one I'll talk a little bit more about, was led by Jonathan Credo. At that time, he was an undergraduate Navajo student who's going to be on the panel later today. He has since gone on to get his PhD and will get his MD on, I kind of has it, but he'll walk graduation in May. And he's really done a lot of work in this area. And then the other was by Lindsay Jones. So she's shown next to Credo up there for her master's project, looking at specifically Western Navajo. So I know this is a really busy map, but what this is trying to show you is the outline of the Navajo Nation. You can see down in the southwest corner off the reservation is Flagstaff, where we are now. So all those yellow stars are unregulated wells that our lab has sampled at least 3 times, some of them many, many times over the years. Most of this work is from 2003 on to about 2017. And then in addition, you'll see other markings for water samples that we could get information from the Army Corps of Engineers, from the CDC, and from the US EPA. And so this is just to show you the expanse. My students are great at collecting and going out, and they camp out on the res and then go collect more and have lots and lots of stories. I go out except when they camp because I'm old and I don't camp anymore. So this is, I know this is a really busy slide, but this is trying to show you sort of the extent of what we reported in the publication by Jonathan Credo. 296 water samples were collected from these unregulated wells. And what he tried to show were 21 different elements that we analyzed for. And the way he set up this table was that he had the maximum concentration within those 300-ish samples, the minimum, the average, and the median. Okay, and so you can see a list of all those different elements that we looked at. And so most of the work was done on the inductively coupled plasma mass spec, which is in my lab. And so we also, he reported really numbers in the different regions of the Navajo Nation. So again, remember, we have the different Navajo agencies. So he has those listed across the top. And then for really elements of interest, he has then whether they were above the maximum contaminant level, which is the EPA sort of drinking water standard, whether they were approaching that standard value, whether it was below, but we could still detect those values, or whether it was below our detection limit, which is BD. Okay, so you just get the feel from within a certain region of the Navajo Nation, whether there is bigger issues, say with uranium or with arsenic and that kind of thing. So additionally, these are just some of those 300 wells. And so this, when we talk to the community, this is really the type of graph that we use, where on the y-axis is the concentration of either arsenic or uranium in part per billion or micrograms per liter. And then on the bottom are different regions. So just sort of a snippet of some of the wells, either in the, different central and so forth. And so the most important thing, I think, for the community is those horizontal lines. Those are the drinking water standards. So for arsenic, it's 10 part per billion, and for uranium, it's 30 part per billion. So when we report back to the communities, we say, if these bars are above that line, you really don't want to be drinking that water, because those are, by EPA toxicology standards, not safe to drink. And so you can see there are wells that are quite high, and then you can see some, his Credo's approaching, you can see those are close to those lines, and so just letting people know that. And so I'm going to move to then the work from Lindsay Jones, who's shown there. And she really focused her work in the western part of Navajo. So what you're seeing is a map of Western Navajo Agency, and all the dots are all the different wells that she sampled. A total of, I think, 82 different wells sampled multiple times while she was doing her master's work. And so in the western part, ore was collected, leaving these really large footprints. Also on that map are the X's. So those X's are the abandoned mines. And so you can see they're mainly concentrated down in the southwestern part of the Western Agency and particularly in the Cameron area. So we've done quite a bit of work in that area. So what Lindsay did with her data was to make these either arsenic or uranium risk maps, really as a way to be able to show some of the issues in that area. So you can see she focused her work on arsenic and uranium. So the larger and the darker the circle, the more issue that is with the water in that area. So again, not surprisingly, in the mining areas down in the Southwest, you see the biggest issues with arsenic and uranium. So the other thing that was really innovative that worked super well was how Lindsay decided to disseminate or give that information back to the communities. So what she did was she put together a booklet. So that's the front cover you see there of the information. And the most important thing she did was on one side of the page was a map of that chapter, so that community with the wells that were sampled, you know, shown on the map. And then on the other side, she gave the information for arsenic and uranium using those maximum contaminant level or drinking water standard horizontal lines. So again, we could talk to folks about, you know, if those bar graphs are above those lines, this is an issue. And then she summarized her results for that specific chapter. The reason why this worked well was because a lot of those wells have a designation that was given to them by the Indian Health Services or whoever dug those wells. And so they might be referred to as 5K-634 or something. The community, like, what is that? Where is that? It's not familiar to them. But with the map, they could see location-wise where those wells were and be able to say, oh, that's Auntie's well, or, really be able to put that information together. So she had these different pages for each of the chapters in Western Navajo. So I'm going to Mexico at the time. And like I said, it's kind of expanded as folks from that group have moved to other places. So these are a couple publications out of the University of New Mexico. At that time, the work was really led by Dr. Jani Lewis. And just looking at, again, arsenic and uranium in wells across Navajo. So peer-reviewed journal articles are really important, except community folks don't read those, right? And so we wanted to figure out a way to provide the information that we've collected as well as the UNM folks have collected that really could be useful to the Navajo Nation. And so our group began to work specifically with Dr. Joe Hoover, who was a postdoc at the time at UNM and is now at the University of New Mexico or University of Arizona, along with a graduate student, Daniel Bean, and really trying to combine the information that we had into one database. And so that work was really, a lot of that was done by undergraduates in my lab, just taking the information, trying to make it a little bit more uniform so that it could be usable. So in addition to our data and the UNM data, we also collected data from many different sources, as you can see up there, because we really wanted to be able to look at the whole nation if we could. And so it was, very helpful. Took a little digging, but trying to get all this information. And so we were able to compile, over 1,000 water sources across the nation. The dots show all the different sources that we were able to combine. And not every source had the information, but we did the best we could to collect what we could. You can see there is not very many dots there in the eastern part of Navajo. So quite honestly, right now, Joe Hoover, who's at, like I said, U of A right now, he and I are trying to fill in those areas because we know there's livestock wells or unregulated wells in those areas. So we've started to sort of work through each of those chapters. So we combined this work started in about 2017. We completed it mostly in 2019. 2020 comes and it's the COVID pandemic. It hit Navajo really, really hard. It was at one point the highest rate of infection in the nation. And so, why am I bringing that up? Well, it really, really made an effect on water hauling practices. And it's because it was so bad on Navajo, there had to be something done. And so the tribal leaders decided to have lockdowns on the weekends, which meant you were supposed to stay at your home, and to have curfews during the week, meaning you were supposed to stay at your home after 5. This really hampered folks who had to haul water. Again, 20 to 30% of these households don't have running water. And so now trying to find sources that weren't too far away, those types of things. And so it turned out then the information that we had put in the database was fortunately, available for people to be able to access, or at least the tribe to be able to access, to provide public health information to folks to tell them, stay away from this well, that type of thing. So this is just a map of, again, the Navajo Nation showing you some of the water insecurity issues. Those darker rust-colored areas are areas that really have a lot of homes that do not have running water. So you can see a lot of them are in the western part of Navajo. And so those are the folks that are relying on water sources, wherever they can get the water. And so another thing that came out of some of this work, and really with a larger group of folks called the Navajo Water Access Group, was this Navajo Safe Water. And it was a way, again, to try and give information to folks because they were, really struggling because their way of life had changed a bit because of these lockdowns and curfews. And so this is a website that was built. And in the website, you can see these are more point sources. So these are sources of regulated water that people can access. And what folks could do is to hover over those points and then get information about that particular well. And so this is actually live, and so people can go look at this. Now, Daniel Bean, who I mentioned previously, he's working on his PhD at the University of New Mexico. He is building a similar website, but for the unregulated sources. So all the information that is in the database, so it's more accessible to folks. And so he just beta tested it on a few of us just to see, how it's working. And so I suspect that will be out in the next, 6 months or so. So lastly, I just wanted to end with information about how my lab has really learned a lot about giving information back to the communities. Like I said, we are very much peer review publishers, but more important, if we're going to do this work, we better be giving the information back to the communities that we're working with. And so this is just 3 different approaches, with one of them that really didn't work. So the first approach, actually, Dr. Rock over there, attempted, and this is a pretty typical, radio announcements, flyers, we're going to have this meeting, come and we'll tell you all about what we've learned. And people just are busy. And so they don't come. And so he found that working with grassroots organizations and really having them help to guide how you set up these report back meetings, worked much, much better. And so he's shown there talking to some folks from Cameron. And then the development of this booklet, and then really going on the road. So Lindsay went to many chapters and described it. We took a number of those booklets so that people can give them to their neighbors and so forth. That also seemed to work pretty well. And so we did publish a paper on what we learned in terms of this dissemination. So with that, I'm going to just thank folks that have helped us along the way. Mike Ketter, who is emeritus at NAU, a world-renowned radionuclide analytical chemist. Very fortunate to have him as a colleague. Of course, our collaborations with all the Navajo Nation communities and the governments. Dr. Jani Lewis's group at University of New Mexico. Like I said, this Navajo Water Access Coordination Group, who's been building these, the websites. And then all my students over time, definitely funding from a variety of different National Institute of Health institutes, as well as the EPA to do this work. So with that, I will answer any questions.
And just to let everybody know, if you push the button on the little microphone, if the speaker comes on. Jani, I've got a question for you. This is amazing work and I love the detail.
Thank you.
Has there been an overlap of looking at healthcare related conditions related to the specific wells and the specific regions?
Right. So that's actually a new project that I have. So I have a project funded by the American Cancer Society that I've wanted to do for a long time, and that is to look at cancer diagnosis and where folks live and their exposures to the legacy mining. So we have permission from the Tuba City Regional Health Care Clinic or Center to review medical records. And then we've been doing, and this is all in Western Navajo, and then doing the environmental. We really are trying to do, it's more of an epidemiology study, which I'm a trained analytical chemist. So, but I have found a Navajo environmental epidemiologist who's going to be joining as soon as she finishes her PhD at the University of Arizona. So yeah. And then actually in the panel, Dr. Jonathan Credo will be talking a little bit about that as well. That's definitely a passion of his. So.
Very good. Thank you.
One question, as far as mine remediated, do you have any data there as far as how long does it take? Are you seeing any improvements in the water quality and contamination?
So few of them have been remediated that it's just tough. And the tough thing is that, this mining started in the 40s and there really isn't great data of water quality prior to that, partly because, and this is the analytical chemist in me coming out, but there weren't the instruments to really make the types of measurements you needed to make. So there is controversy as to, well, it's always been that way. It's not the mining that has brought this out. And so there's been more geochemical type folks trying to fingerprint and see, but yeah, I think that's left, I think the area we've done work up in Cove, which is in the Four Corners area, and they really have had some of the more recent remediation. So that's probably someplace we'll start to look. Cameron has a little bit going on. So yeah.
Yeah, we do have one online question. Will there be any research on who dug the wells on Navajo, or is there research on who dug the wells on Navajo?
People, they pretty much know, like a lot of them are from the Indian Health Services, IHS. There have been a few dug recently, and I'm not sure who has funded those. That might be a good question for the panel and Dr. Rock over there. But he did a lot of work when he was in my lab, just searching out who did dig those wells. Actually, more specifically, what is the depth of the well and the year it was dug. But that information is there. It's just tricky to find. Yeah.
Some of those wells came from U.S. Public Health Service. From 1923. The funding came from the chapter for these springs, natural springs, and improve them, where it will put like a slab of cement, like a 500 gallon storage tank, and the water will trickle there. And once it goes up, the people can go over there. You can see a lot of hand pump wells. People go over there and get water from there. So there's a lot of them that are still up there, and a lot of them are in the ABRC facility that the regional health ABRC facility that have been in. Some of them are in PDF form, some of them are still hard copy. And talking to them, they're talking about digitizing them. So
Yes.
Good question. What are like the remediation strategies that have to?
Right. So I'm most familiar with Cameron. So Cameron is in the western side where there was the open pit mining, and the community has pushed for, soil cleanup, but it's really expensive. And so EPA is looking at just covering, right? And so there are issues with that because there is the leaching into the groundwater. So I worked very specifically with a community member who has pushed for, then it needs to be monitored over time. I know more on the eastern side where it was underground, it's a little bit different approach. And those are, and I could be wrong, but I think those are less difficult to remediate because you don't have such a big footprint. And some of them have just been fenced off. Don't come in here. Some of them are not even fenced off. There's just signs that are posted. So I actually have a graduate student who's going to look at a big mound in Cameron, which is so close to people's houses, but it just has the fence, the signs. And we're just going to kind of look going from the mound out toward the homes to see if we see, does it drop off or, what happens? Because there's a lot of dust that flies. So I have another student who has put together these sort of citizen science dust collectors, and he just deployed one in Cameron. And so that then people could take the filters, which are just N95 masks, and send them to the lab so that we could see, how people are being exposed through the dust. But the remediation it's really expensive, and it tends to be a lot of research, like what should we do? What should we do? And I've been in chapter meetings where people are like, stop studying us, just clean it up, and it's hard. So, yeah. Yeah. So that's why I think the most work has been done up in Cove, and that was the first place they mined. So then I think that probably has the highest concentration of mines in that Four Corners area. So, hopefully in our lifetime, we'll see more of these mines being actually something done for them. So.
Make sure I get my mic on. That I can't remember the name of the policy you mentioned that prevents people from mining. What happened with the pinion pump?
Yeah. So again, I don't, Tommy, do you know why they got permission to haul across the res?
Is it on? Is the mic on? Oh, well, they were able to transport uranium ore through Navajo Nation because that's a state-owned highway, and the tribe has no jurisdiction over it, and that's the reason why they're transporting uranium ore through Navajo Nation.
Yeah. So along those lines, though, they've been talking about opening that mine for a long time. So I had another graduate student back in when Alex was here, 2012-ish. Anyway, he collected samples all along 89 on both sides of the road, all the way into near Doney Park and Flag. So we have baseline information. So the plan is that then once things start hauling, we want to deploy some of those air monitor systems to see the dust when the trucks go by, or passive sampling systems, and then just see if we see differences. So we feel good about having that baseline information, which we really don't have for the water. So, yeah. Well, thank you so much for your attention.
All right, that was fantastic. Thank you. And looking forward to your next work, looking at proximity to the mines and disease. Thank you. All right, so next up, we're fortunate to present Hsini Lin and Nikki Lavardi-Kosh from the Arizona Department of Health Services. Hsini Lin has been a part of ADHS since 2004. She is the office chief for environmental epidemiology and began her public health work at ADHS as an environmental toxicology program manager. In her previous role, she provided technical guidance and support for multiple and diverse environmental health programs. Currently, she is responsible for leading efforts to communicate adaptation interventions, providing recommendations, and assisting with the development of implementation and monitoring strategies for environmental health issues in Arizona. Niki Lavardi-Kosh has been with the ADHS since 2017. She is the program manager for ADHS Well Water Program. She has her master's in public health from Washington University in St. Louis and has 6 years experience in environmental public health, focusing on health communication, environmental public health tracking, and well water education, testing, and outreach. So thank you two very much. And please help me welcome them.
Hello, everyone. I am Hsini, and that's Nikki. She's here with me today. As you already heard where we're coming from. So today we're just going to share our experiences in dealing with drought from the public health perspectives, and then list it. Oh, sorry. Does it work? This is an outline for our presentation. We're just going to provide some background about drought and then water supplies and demand in Arizona. And then after that, we will talk about some potential impacts to the public health. And then after that, we'll share what we have been doing to address those public health concerns from the Office of Environmental Epidemiology. And then at the end, we'll have some time for questions. So as you can see, this is shows the precipitation on the corner, and then for the US, and then on the east side of the US, there's a lot of rainfalls on an annual basis. If you kind of focus onto the southwest corner of Arizona, you can see there's a very, very dark red regions. And then in that small region, we only have less than 5 inches of the rainfall annually. In fact, in Yuma, the rainfall can be less than 3 inches annually. And then as you move in towards to higher elevations, the precipitation amount will be increased. And then so nobody is going to doubt that Arizona is a very hot and dry environment. And then in the past years, the population growth has increased rapidly. As a result, our water demand is increasing as well. So right now, Arizona is a home for 7.3 million of the populations. And then surprisingly, most of the population are stayed in the more urban areas. And most people reside in Phoenix and the Tucson areas. And then there's some larger cities like Flagstaff, Yuma, and also Kinmans, and that have quite a few population as well. The rest of the population is kind of dispersed throughout the state. And then we also have very diverse cultural. So far we have 22 federal recognized Native American tribes that's within the Arizona. And then on the right-hand side, you can see based on the landscape, Arizona can be separated into 3 different zones. On the top is the Colorado plateau, and then at the bottom towards to the south part is basin and the range. That's more hot areas, and then in between we have the transition zone, and then the elevation in Arizona's landscape can range from 70 feet to 13,000 feet. And then, so the water source and the climate is very different among those different zones. So drought, based on the definition, the drought is basically your average precipitation is below, sorry, the rainfall is below your average for a long period of time as a result, and then you kind of have a shortage of the water. So in Arizona, in average, we lose 7 times more water to the atmosphere than we receive from heat from it. So what that means is that we have more water going up to the sky than what we are receiving, and then every living creature relies on water, so that can be a potential concern for people living in Arizona as well. So in fact, Arizona has been in the drought condition for many years, since 1994. And then we have on and off wet and dry years, but in average, like we have more wet years, like more than in the past years. And then so we still stay in that drought condition. As you can see from the slide, the annual average rainfall has been dropped since 1994. And then the average statewide precipitation is about 12.27 inches. And then the effects on the temperature is kind of going to the opposite direction. Since 1994, our statewide annual temperature has been going up about 0.5 degree Fahrenheit. And then, so the average statewide temperature is about 59.7 degree Fahrenheit. And then, so the reason I'm bringing this up is that because the temperature can affect the precipitation and the humidities in the regions. So for example, like during the colder statewide temperatures through March can delay the peak snow melting, and then the hot summer high temperature in the July can decrease the soil moistures and then to intensify the drought conditions. And then on the right hand side, you can see the temperature distribution like at the northern part and southern part of the Arizona. So that was the presentation from last year. You can see our northern part is much colder than usual, and then the southern part is a lot hotter. So in average, it can cancel out its effects. And then so that's why our annual average temperature did not really change much for last year. And then next, I'm going to talk about where the water that we use are coming from in Arizona. On this chart, you can see Colorado River is a big contributor for us to get our water. And then there are about 18% of the water is coming from the in-state rivers. So that's kind of mainly surrounded the Salt River water systems. And then those waters kind of supplies the Phoenix usage. And then we also have 5% of reclaimed water. Those are treated wastewater. And then there is a big portion of the water supply is coming from the groundwater, which is 41%. And then so the source from the groundwater, mainly coming from the rain and the snow, and then they will find their way, sip through the cracks and the granules, and then reach to the ground. And as they get there, they will stay there for a long time. So the groundwater we use that has been there for many, many years. So this is kind of shows the Colorado River Basin. So Arizona is one of the states that in the Colorado River Basin. And then so the Colorado River Basin, again, the water is also coming from the rain and the snow. And then what happens is that, so it can be separated into two portions, the upper Colorado River and the lower Colorado River basins. And then there is a breaking point is these ferry is like a little bit below the Lake Powell in the northern Arizona. And then so in the lower regions, the water goes through the Nevada, Arizona, California, and then flow go through the Mexico. And then so the water kind of supplies the population around those 7 states. And then we kind of share the water according to the agreement. And then so what else we have? Sorry, I cannot read. And then besides the service serve as the drinking water purposes, it also provide the agricultural to farm the land. About 5.5 million acre land is relying on the water. And also it comes up with lots of other economy benefits along the rivers. There's some tourism and recreational use. So in a total that has about $900 billion of the economy effects associated with the water from the Colorado River. In addition, there are quite a numbers of the Native American tribes that live along the rivers, and then they have deep cultural and the spiritual connections with the rivers. The growing demand of the Colorado River and also the shortage on the supplies in the recent year, those water will not be able to actually go to where it ends. It will get dried out before it reach the delta. So this slide, the picture shows the Central Arizona project. It delivers the water to the central part of the Arizona, mainly Phoenix and the Tucson areas. So that's the water coming from the Colorado River. Before the Central Arizona project was started, people in the Phoenix and Tucson area, they kind of rely on groundwater. But again, groundwater is finite resources, and then the government sees there's a need to provide additional water sources. And then so they built the canal in 1973. It takes 20 years for them to finish the whole project. The whole length of the canal is 330 miles long. And so a little bit over than half of those water in the canal is transported to Phoenix and the Tucson regions. And then the other rest water is kind of provided the water for the towns and the farms, and also some tribal nations, and whoever wants to use the water, those water, they can be used directly, or if they are additional left, then they will be recharged into the ground. This slide is kind of show the water used by the different groundwater basins. And then so as you can see, so on the slide, the green color regions that kind of represented in the area, more than 75% of the water is coming from the groundwater. And then for the blue colored areas, more than 75% of the water source is coming from the surface water. And then you also see those gray area with the pie chart is kind of to show the distribution of the water coming from surface water, groundwater, or reclaim the water. So as you can see, there's a lot of green on this map. And then so it's kind of, again, emphasize the importance of the groundwater for Arizona, and lots of people are relying on groundwater for their domestic usages. So this one, kind of to show that Arizona used approximately 7 million acre feet of water statewide back in 2017. And then so acre feet water is basically the amount of water that can cover 1 acre feet, 1 acre, and then with the depth of 1 feet, and then that can supply a few families, maybe from 3 to 5 families, the water usage for a whole year, it depending on how they use the water. And then so we receive that much water where those water goes. So the majority of the water, as you can probably imagine, is going to the agricultural use. It's more than 70%, a little bit. And then about 22% were used for municipal purposes. And then those are the waters that can get from the water providers or also for the business. And then you also see a little portions of those industrial use, those water used for the industry purposes, but the water is not coming from the water providers. And then so they can just get the water from the surface water or draw from the ground water. And then, so before 1980s, there was no regulation for groundwater in the state of Arizona. So you can imagine everybody would just dig a well and then draw the water from the ground, and then there are consequences to comes with that. And then so the water well, they will get dried up, and then the land will get sunk, and then have some cracks to that, and then so the government feel like there's a need to address those concerns. And then so they come up with the Groundwater Management Act. And then during that time, that's when the Arizona Department of Water Resources was established. And then so that agency is kind of regulate in charge of the groundwater withdrawal in the state. And that was the first time in Arizona. And so for the most populated and overdraft areas in Arizona are designated as the active management areas that you can see on the slide, those green color regions that includes Prescott, Phoenix, Pinal, Tucson, and the Santa Cruz areas. So for each one of those active management areas, they will have restrictions on the groundwater usage and regulations. And then each one of those regions, as you can see, they will have different characters and different water needs for their areas. So they will work together to come up with the plan for their regions. For example, the goal for Phoenix is to have safe yield. So what that means is they are hoping whatever they take out from the ground, they can put back in with the equivalent amount, so their water can be sustainable over a long time. Anyway, for those active management areas that can cover more than 75% of the Arizona population. And there are also 3 little orange regions. Those are the irrigation non-exempt areas. For those areas, the purpose for those areas is they want to protect the existing irrigated farmlands. So in those areas, if you want to have new farmland for the irrigation, you need to get permission. You cannot just get some water and then to irrigate the farm. There are lots of restrictions. And then so those are the some strategies that Groundwater Management Act come up with to protect our groundwater sources. And then another cornerstone for the Groundwater Management Act is the Assured Water Supply Program. So this program kind of require any developers, if they want to build a house on a certain land, they have to prove that that land they have enough water supplies for 100 years, which is more advanced in California. I think California is only like 25 years. So that's really important. And so they have to prove that their water is in good quality and they own the water legally, and then they have enough funding to set up the facility to deliver, treat, and store the water and all kinds of things. And then the water quality has to be good. They have to, and so the next slide is kind of to point it out that at this moment, besides those active management areas, there's still no laws to regulate the groundwater in Arizona. So for those outside of the active management area, we kind of just call them a rural Arizona area for now. But so there are consequences of the overdrifting of the groundwater, as we discussed, that you're going to have lower water tables, and then the plants, their roots will potentially lose the water, and then that can affect the growth of the plants and maybe the living organisms that relies on those plants. And then also it can lead to condense of the aquifers, and then so over time it won't be able to hold as much water that may be prone to flooding. And then also have the land subsidence, right? So the lucky thing that happened last year is the governor, she issued an executive order and then require the formation of the Water Policy Council. So that Water Policy Council is supposed to review the current Groundwater Management Act, and then to provide the recommendations on the needs for revision, addition, or revising the current regulations that also include the non-active management area. And those recommendations was shared with the governor's office in November last year. So hopefully there was some good things happen in the near future. So that's a little bit background about how the groundwater situation in the Arizona. And then the next few slides, I'm just going to share some potential concerns about the public health outcomes as a result of the drought. So drought is kind of manifest differently as the other weather-related hazard or natural disaster. For example, like the flooding, you can see those health outcomes right away, or even extreme heat events. People go to the hospitals. Drought is kind of slow working, and then their impact on health outcome is significant, but not easy to observe. They are kind of the health threat multipliers that kind of work like the climate change effects, right? So climate change itself really not does cause any health outcome. However, climate change can lead to more intensified heat waves or more flooding events that can lead to health outcome results. So here is a list of the potential health outcomes that can associated with the drought. So you will have some impacts on food securities, and then also the water quality and the quantity, as well as maybe have more frequent dust storms and wildfire, and then more intense, more frequent heat wave events, and also that can have changes on the vector's habitat. So I'll just start with some points for the water quality. So the drought can impact the water quality and the quantity in a negative ways. So first of all, you're going to lose available or have a shortage of the water. And then because of that, as we discussed, it can lose the soil integrities. And then those soil may be more prompt to floodings when the water comes back, and then the soil dries out, right? The roots died. And then so lacking of those root systems, they can increase the risk of a flood. And then it also associated with poor hygiene. Again, as the doctor said, that people will have to hold the waters, and then during that process is that increase the possibilities for contaminations. And then with less amount of the water, people may not tend to wash their hand as frequent or bath as frequent. And then so that can lead to some diarrhea associated with diarrhea. Actually, research has found out that during those poor hygienes, and then the skin infection rate has been increased as well. And then the quality of the water can also be impacted by drought. For those long drought period, the chemicals, they can accumulate on the ground. And then when the water returns, those chemicals can leach in or through the water supply systems, and then they can be concerned by the whoever used the water. And then also the water table can fluctuate, and that kind of impact the concentration of mineral and metals in the groundwaters. And then they can trigger the drought can trigger more water pumpings. And then so again, the water is going down, and then while you are trying to pump more, and some of those chemicals at the upper layer of the aquifer may be drawn down to the deeper areas. And then the USGS has found out that the drought kind of leads to more exposure to the arsenic for the people that use the groundwater. In Arizona, arsenic is kind of high in natural, so lots of our groundwater contains arsenic, and then so that's a potential concern for us. And then since it can lead to lots of different types of the cancer. And then the drought can also negatively impact the quantity and the air quality through different ways. So for example, the drought can lead to intensified the wildfires, like those dried plants, they can fuel the wildfires. And then also the frequency of the dust storms, and again, those particular matters that are floating in the airs can lead to low visibilities that can cause accidents on the highways, and also maybe stir up some of the cocci spores that buried in the soils. And then all these can, or both the wildfire and the dust storms, they can worsen the respiratory related disease. So we also say the drought can intensify the heat wave, right? So heat can lead to heat-related illness. And then in fact, last year, many emergency rooms has received patient reported to have burns due to the extreme heat events. So our heat events has been intensified, and then we see increased the numbers of heat-related deaths. Actually, last year we have like 987 heat-related deaths reported in Arizona, and last year we have like we have 31 days like consecutive temperature above 110 degree. So that's a concern. As a result, the governor, she also issued an executive order, try to direct the state agency to collaborate together to come up with extreme heat preparedness plan. So this is kind of to show the timelines of the publishing of those preparedness plans. So it's a collaborative efforts among the state, local, and the community and stakeholders. They work together during the heat summit that held by ADHS in October, and then through the various work groups, and then we provide the recommendations, and then eventually some of those recommendations are integrated into the governor's preparedness plan for heat. So the drought also leads to mental health. Basically, the association of drought and the mental health is coming from the economy impacts. Drought can cause economy losses to business. For example, you have to cut down the water for your farmland, and then that can be a potential issue, loss of crops, and or you are doing the landscaping. So drought can also impact your business, and then because of that, people can lose their jobs, and that can increase the anxiety and risk of depression because their life is being challenged. And also people may experience those stress at the homes because you have less incomes, and then that means you will have less money for you to pay for your food, and then the loss of the crops, and then can make the food price going up, and you might have to buy food that are imported from different countries, and then all that can lead to the increased risk of anxiety and the depression as well. And then as a result, you may see more alcohol consumption and domestic violences. And so the study also showed that kids that live in more drought areas, situations, they have increased the fear and feeling about losing things that can increase their risk of anxieties and depression. So the last slide I would like to share with you is the vulnerable population. So all populations are vulnerable to the health impacts associated with the drought, but some people are impacted more compared to the other ones. In general, those are the communities of colors, low-income population, because they have limited access to the health care, and then maybe lack of resources. And so one way to address this is to come up with preparedness plans, and then so while doing the preparedness plan, we'll take those into consideration, try to be inclusion of those vulnerable populations. And then next, the Niki is going to share what we have been working with the groundwater well owner community to address those public health concerns.
Thank you, Hsini. So as Hsini mentioned, groundwater and public well owners in particular are vulnerable to drought. Private wells, for anyone who doesn't know, they are water systems that serve less than 25 people or have less than 15 connections, and they're a source of unregulated drinking water as well. They are essentially responsible for maintaining their water quality and quantity, and they're left to do this on their own with, of course, assistance from agencies like ourselves. In Arizona, it's estimated that about 5 to 7% of the population is using a private well for domestic purposes. There aren't really many financial resources to help them with situations of drought, and they can be hard to reach because they are very remote, and sometimes there's a lack of interest in working with the government. In addition, as Hsini mentioned, with drought, that can change the chemistry of the groundwater and make certain contaminants that are commonly found in the groundwater, such as arsenic, more concentrated. So it's really important to get the message out about water testing before, during a drought as well. So to address this gap, we have a private well affordable testing program. Essentially, the well owner is responsible for shipping the containers back to us. With this test, they get to test for 16 different metals, and we return these results to them, highlighting which ones were above MCLs, and also giving them health education materials and strategies to mitigate those elevated contaminants. So the program works like this. We have a registration form. People can sign up. We'll send them the kit with the instructions for collecting the water. They return it back to us. And then, as I mentioned, we return the results with information about next steps if they have any high concentrations. Another thing we do alongside the private well program is having resources available to educate them, as I mentioned. As you can see here, we have our arsenic brochure, and it shares information about why there's arsenic in the groundwater, what potential health impacts it can have, and at what levels it's safe to use. We also have a well owner's guidebook that contains comprehensive information about owning a well in Arizona. It goes through like the Arizona geology, how they should register their well with the Water Resources Department, and also mentions information about signs and symptoms to look out for in their well if there is a drought, and promotes, good water conservation habits. And we also have a series of well owner videos that shares the same information in a video format. So I want to highlight another agency that's doing work to understand what the groundwater quality is in our state, and that's the Arizona Department of Quality's groundwater monitoring program. What they're doing is assessing the groundwater quality in the 51 aquifers throughout the state of Arizona. They test for over 200 contaminants, and they collect samples from many different kinds of wells, including domestic wells, community wells, groundwater monitoring wells, and agricultural wells. This testing that ADQ did helped inform our water testing recommendations for private well owners, which includes arsenic, uranium, fluoride, bacteria, and nitrates. And we can provide more information about this program if anyone is interested in participating or learning more. We have taken their historical data and put it on our Arizona Environmental Public Health Tracking Data Explorer. This database brings together environmental and health outcome data for health professionals to use, investigate, inform public health interventions and actions. So if you were to go on there and look at the groundwater data that we have, you would see this dashboard essentially. And what this is showing is the results from the groundwater monitoring program from 1993 to 2017. It's broken down by basin, and in the table you'll be able to see by basin how many wells were tested and what percentage of wells were above the MCLs. And we have this information available for 5 different contaminants: arsenic, fluoride, gross alpha, nitrate, and uranium. And this tool has been helpful to share with private well owners to let them know what's going on in their area, as well as other stakeholders. The groundwater program is actively collecting samples again, so we plan to update this data when that data becomes available. Another program we've been doing to understand water quality and exposures in the population is biomonitoring. So biomonitoring, as it sounds, is the measurement of chemicals in human body, and this is usually done through urine or blood samples. From 2016 to 2019, we participated in the Four Corners Biomonitoring Consortium, where we, with Utah, Colorado, and New Mexico, of course, and we were working together to understand what the exposures of largely well owners were to metals, pesticides, and phthalates. We published the summary results on our website, and we found that amongst well owners, metals exposures was higher than the national average, which we get from the NHANES report that CDC's biomonitoring program does. So as I mentioned, we applied for this grant again. So we're looking to pick up the work and further the research. And we're also looking at testing for PFAS exposure in the population. So PFAS has been an emerging contaminant for a while. There's been a lot of focus on this the last several years, and the EPA and the state of Arizona have been doing a lot more monitoring of PFAS in drinking water systems. As it's stated here, PFAS is a group of chemicals that's been used in industry and consumer products because of its resistant properties. Over the years, it's made its way into the groundwater, and because it's inert and its ability to accumulate, the public health community has been investigating the potential health impacts. And with that, we have been doing some PFAS response with the Arizona Department of Health Services. Arizona Department of Environmental Quality. As I mentioned, they've been doing statewide sampling to understand what the PFAS levels look like in drinking water. And luckily they found that, more than 80%, there aren't even any detectable limits of PFAS. For the other percentage, there are some detectable, and some of them are above the MCL that was recently published. And we've been working with them to go to community meetings and address concerns within the population when they have questions about how this could potentially impact their health. With the PFAS becoming regulated, there's a potential for supporting funding to do well water testing, private well water testing. And so we're working with the Department of Environmental Quality to see what that program could look like, because testing is very expensive and it's probably cost prohibitive for many well owners to be able to do that test. And so we're hoping to use what they found in the drinking water sampling to target private well owners throughout the state. And then, of course, we have been updating and developing fact sheets and a website to bring awareness to and help the public understand what PFAS is and what steps they can take to prevent or protect their health. Luckily, with PFAS, it is we're able to mitigate it with reverse osmosis and carbon filtration. Another resource I wanted to point out that our agency just developed is the Arizona Social Vulnerability Index. It uses the CDC's Vulnerability Index as a foundation and adds like Arizona specific information. The Social Vulnerability Index is a tool that can help public health emergency responders plan, identify, and map where the vulnerable areas are if there's a public health emergency. And with this Arizona specific map, we have information that includes like rent burden, tree coverage, heat vulnerability, health, care access, water costs, and access to smartphones. So we're able to use this map to understand what areas are vulnerable to, we could even say, drought. The map that Hsini showed earlier, parts of Yuma County have been in drought for a long time, and you can see there are certain parts of Yuma that are particularly have a high vulnerability index. So we can do outreach in those areas for drought on that. And then lastly, I just wanted to point to some resources that may be helpful for healthcare professionals to review when they're navigating issues around water quality and drought. Recently, PFAS information for clinicians was released from ATSDR, which is the toxicology branch of CDC. The document goes over how physicians can access information about exposure to PFAS within their patient, what are the common health effects, talks about potentials for testing, and gives advice on how to support patients in reducing their PFAS exposure. There's also a drought guidance document that was published by the University of Nebraska College of Public Health that gives information to healthcare providers and public health officials, information on how to communicate about the health effects of drought with their patients and the broader community. And then, of course, there are water quality reports that can be accessed on our environmental public health tracking portal if there are any concerns about environmental exposures within patients, and we're happy to assist with using that tool. And as I mentioned, we have a plethora of private well information that could be helpful to reference as well if a patient is on a private well. So we're happy to share all those resources. And with that, that concludes our presentation, and we're happy to take any questions.
I was curious around the social vulnerability index. Have you tried? Are there other ways that you could calculate that? This one seems to be very targeted towards drought. Correct?
No, actually, I was just saying that we can use this to target people with drought. This takes a bunch of different things into factors. Some of the things I mentioned, like rent, water access, smartphone access, and it's also taking in the vulnerability index from CDC, which have to do with like socio-demographics, transportation. Overall, it's just used for like being able to understand where we need to direct resources and attention if there's a public health emergency of any kind.
Okay, makes sense.
Yes, go ahead.
Okay, there we go. It's green. So this is a question about reclaimed water. So the one map that you showed that had, I mean, it looked like Coconino County or Flagstaff had a pretty good chunk of the pie, but a lot of the other areas were a very tiny sliver. Do you know, is that Does it seem like that might change? I mean, what are your thoughts on that?
That's a very good question, but I'm sorry. Thanks. That's a good question, but in general, our department do not oversee the reclaimed water. It's under the regulation of the Department of Environmental Qualities, and then so yeah. We're
Okay.
happy to make connections for you if you like.
Well, I'm just wondering because so my lab, in addition to doing stuff out on Navajo, have been doing PFAS analysis of water samples, including a couple reclaims. And it really depends a lot on how the reclaim is cleaned, kind of thing. Anyway, that also seems like that's going to be a source of PFAS in the future, depending on how it's used. So that's why I was wondering. I mean, obviously we don't have a lot of water in the state, so trying to maximize what we do have is important, but that my student actually just defended her work that she talked about PFAS from Tuba City all the way down to Yuma, and how that could be another source of PFAS in the environment. So, and people are still just understanding, do the plants uptake it? You know, where are their exposures? But it does look like I said, our county, our city uses a lot more reclaim than others. And so I was just wondering if that was going to change. But
I think that will be a part of the discussion because the ADQ has a group of people are working on PFAS, try to think about all kinds of possibilities for the, because when you use those filters and then where are you going to dump them, right? And then so those can be a potential sources for the secondary exposures. And then so those are being discussed and with the stakeholders, and then we are a part of their teams. And I would definitely bring up your concern and then to see where that will lead us to. Thank you.
All right, yeah, probably. Let me move over here. Oh, that one doesn't work either. So my name is Joseph Baya. Can you go back to the slide where it's a nice Arizona map? I think it's the with the vulnerability index. Okay. So I live in Keyenta, Arizona, which is in the northeastern part of the state, right there, yeah, in the Navajo County, in that blue area. And I grew up there in Keyenta, and I'm familiar with the issues with water access. And I now currently serve on we have a township, so it's a small city, it's a small city government within the Navajo Nation. And I work as one of the commissioners, and my focus has been really improving access to water and water quality. And again, it's a political government, so there's there's 4 other commissioners, and I haven't really had the opportunity to see gains and improvements in my focus area of water. And much of our focus has been in economic development, but you see how those are very well connected to one another. If you don't have access to water and quality water, you really can't build out. And I thought in the presentation, it was neat seeing how in Arizona, you have that 100-year, policy for improvements. And I think, and it's frustrating for me because I want our communities to grow. I want us to bring in more businesses. I see the economic development potential that we have, but we have limitations with with our utility source. So we have one utility company, Navajo Tribal Utility Authority, and we've been working with them before I was voted into office, before my term. And we had this really nice project development for an expansion of our community in Keyenta. We're a small population, about 5,000 to 6,000 people. And we were going to add an additional, I think it was like 78 to 80 lots for people. People are on the wait list to build their homes. And I think we were probably around 70 to 80% complete with this infrastructure project, and something changed. And within the last couple of years, our utility authority said they couldn't provide water to that project. So we had to scrap that whole project of about 80 lots. So we have backlogs of hundreds of people in our community that are trying to move in. And I'm wondering, what could I do as a community leader to help improve, I guess, the research that you guys are doing, help provide, I guess, opportunities to help our community out. But then I see that there's that mutual relationship that needs to occur. And in Kayenta, we have our own Indian Health Service. We have the Kayenta Health Center in Kayenta. So we do get reports every now and then on different type of health type research. But I'm wondering, what can I do to further, I guess, water access? And going back to my original point, the frustration, whenever I drive down to Phoenix or Tucson, I always see these mega expansions of real estate, and I'm thinking to myself, like, man, how do they constantly have more and more access to being able to expand these projects? And I know they have to have some type of plan in place that says, they have secured water, access. But up in northern Arizona, we have the upper and lower Colorado basin, right? Is right near us, but we still can't expand and improve our water. And this doesn't have to be just for the two of you. I know there's other presenters. I just would like to hear just some feedback. Like, what can I do as a community member, community leader, to continue this fight to try and improve our area up in that rural Arizona?
I think ABRC will be a good starting point because they are the one oversees the groundwater quality, and then again the governor's executive order try to expand that regulation or requirement outside of the AMAs and inside the Navajo Nation regions. And so I think if we can contact for you, so you can reach out to them, and then I think that's agency that probably can provide assistance or give you some feedbacks where or what you can do to reach your goal.
I know that with Indian Health Service, they have the Office of Environmental Health, and they do drill some wells near Kayenta area, like a place called Baby Rock, about, I don't know, maybe 15, 20 miles east of Kayenta. So I know they have some information about water quality and where the groundwater and the best place to drill for groundwater is. I know for Navajo Tribal Utility Authority, they're tapping to the Navajo aquifer. Is there another possibility of drilling to the Navajo aquifer for the community of Kayenta? Is that a possibility? So I think talking to the folks from Office of Environmental Health would be a really good option as well. It's like talking to them.
I just want to add one thing, if I have a moment. So thank you. This is now working. So I wanted to say, what can I do to, as a community member, and also, as an elected leader, what can I do individually to help promote, I guess, the research that you're all doing locally, and to possibly invite you into our community to do some type of collaborative, I guess, research in our community. And I know that we're part of the Navajo Nation, because Navajo Nation is made up of 110 chapters and one township, which is my community, the Kayenta Township. What could I do to, I guess, help you guys with what you are all doing with your research?
Yeah, I mean, I think we can just exchange information. We've always wanted to go over into like the tribal area, but I don't know, it's never like worked out. So if you're a connection that can get us there, we're happy to like come in and test private wells and share our resources. And if we get the biomonitoring grant, if you guys want to participate in getting tested for like metals and PFAS, then we're happy to provide that as well.
Thank you.
But
I just had a question regarding the groundwater testing results. Is the Arizona Environmental Health Tracker that you shared the most up-to-date place to find those results?
Sort of. So as I mentioned, the results that we currently have are from 19, what is the years? I can't remember. 1993 to 2017, and they are like collecting right now. I don't know how frequently they're updating their database. Like ADQ also has a place where they put their groundwater information. So I would check ADQ's website as well, just to see if there's more up to date, potentially from the sampling that they're doing right now. Otherwise, this is probably the most like way you could visualize it. They also have reports on their website that break down the data by different tables. And I think the other point about this is we've extracted just the information about private wells, whereas they're testing, you know, agricultural wells, community wells, all those different things. So if you want a bigger picture, ADQ might be a better source of information.
Okay, thank you. And then specifically for the AMAs, would that be the Arizona Department of Water Resources, or yeah?
Yeah.
So we're gonna just take a little break now, and we'll come back. Let's come back at say 10:55, and then we'll just shorten lunch a little bit, as I'm sure our next with Michael Charles, with Dr. Charles, I'm sure we'll have some more great discussions. But thank you all so much. Let's take a 10-minute break and come on back. All right, folks, we're gonna start we're gonna continue with our program here today. So next, I'm pleased to introduce Dr. Michael Charles. So Dr. Charles is a citizen of the Navajo Nation and an assistant professor in the Department of Biological and Environmental Engineering at Cornell University. So thanks for making the flight out. He also serves as an affiliate faculty member for the American Indian and Indigenous Studies program. Michael's research focuses on computational sustainable design and community engagement, particularly with Indigenous communities. Specifically, his work explores the role that ecosystems and landscapes can play in sustainable engineering, climate regulation, public health, and the development of sustainability metrics. Along with his research, Michael works with the International Indigenous Peoples Forum on Climate Change to advocate for Indigenous rights, leadership, and self-determination within the United Nations climate negotiations. Although his interests and advocacy transcend many disciplines and labels, most of his work is focused on increasing Indigenous representation in academia, policy, and social movements in the pursuit of justice and collective liberation. So thank you, Michael, for coming, and we look forward to hearing your talk. And you can take your time a little bit. We're waiting for a couple other people to show up. Thank you.
All right. It's good to be here. I'll kind of slowly introduce myself as the coffee crew comes back from the line. But yeah, so today I'm just going to kind of give a kind of a different presentation. I think what we've seen in the sense of I won't be going really deep into anything. I'm going to go broadly scrape across all these different kind of things going on, tell a few stories, and then hopefully give some insights that may or may not be relevant to specifically healthcare practitioners. So I'm going to do my best to navigate a lot of different topics, but also probably won't really dive too much into my research, but may give a few examples of what that could look like. So just kind of wanted to start, I'll do the kind of the same introduction of myself first. I follow along most of a lot of the presenters today being Jani or from Navajo Nation. So bilagan nishleshi bashishin, bilagan dashishin kaidana additionally. So I'm Michael Charles. My family's from Ganado, Arizona. And my Navajo clans come from my dad's side as well. And so we're just going to kind of first start by giving more of just an honoring and relationship to water as just kind of the concept that we're talking about today. And so going to kind of highlight around these phrases that we keep seeing really got popularized during the Standing Rock movements and occupation around water is life. And so I just kind of wanted to think as a group and reflect on just all of the different ways of how water impacts us and connects us. And really want to emphasize that it really is a dynamic life way more than a resource that we often kind of commodify it as. It's a resource and a life way that moves, it transforms, and it provides about 50 to 60% of even our body composition. And I won't go too deep because I also teach thermodynamics, but what's really exciting to me about water is all of the different ways that it changes phases. And so I want to just kind of emphasize what that means. And kind of first just start with the idea of the way water moves. And one thing I was just, I've been reading a book recently, Sand Talk. If you haven't read it, it's a great account of how Indigenous thinking can save the world from an Aboriginal Australian. And he gives a good example of, they have a story where they basically just kind of make fun of this idea that only someone who's really insane would just start running in a straight path or go in the most direct path, because it would mean he's just going to run right into every obstacle. He's not going to really try to navigate or pay attention to his surroundings. And so I think that's something that's really interesting in the sense of that. That's something we can learn, in which we're not meant to flow in a straight path. Life is about navigating those obstacles, making turns, and continuously learning. And the next point I want to make is around all of life is connected through water. We all rely on water. If we think about even the water cycle and the ongoing impacts, and I'll give it through the example of climate change, there's these different phases of water that's going to impact our relatives across the world in so many different ways, and in the different states and phase changes. And so if we think about starting up in the north in the Arctic, right, our water is going to be sitting as ice. And as we think about climate change, that's going to be ice that melts. And it's going to be the same water that's going to then make our relatives that are on islands or across shorelines more vulnerable to losing access to those landscapes. And then the other connection that I can think of is where we're going to really see some heavy rains and storms that are really going to kind of shock communities and be a huge part of what climate adaptation and resilience means for them. In the same way, like here in Arizona, we're also going to have to think about how we manage drought and the lack of water. And so I think the last part I wanted to think about the teachings of water to start this talk is around how life is really meant to flow between rest, regeneration, and powerful changes. And I think if we continue on with the concepts of the water cycle, we can think of how even just today, this morning, we see the snow that's just resting atop the mountain peak, or the water that's resting in glaciers that have been there for thousands and thousands of years. These are going to go ahead and melt into these powerful streams, or in some cases, as we think, maybe wake up as rising oceans. And these phases of rest and regeneration is what's going to allow waters to create new pathways, powerful enough to erode rock that's witnessed different epochs across this whole planet's history. And I think what's really good about being home in Arizona is that we're familiar with the power of water. And if we just look at all the different canyons we have around us, and rumor has it, there's one that's pretty grand around here as well. It's probably just the first of a few really bad jokes. But we cannot forget that really water is transformative within her own changing of states and through her interactions that span all of life. We have these interactions. So I just kind of wanted to set the stage for all of these different kind of topics we're going to bring through by just kind of sitting and connecting with just water to begin with. And so there's this kind of phrase that we use, and that's kind of been common around, which is that we all live downstream. But I think that same counterpoint is that we all live upstream. And so this is going to be kind of, the talk's going to be really focusing on two aspects, really. The first being the consequences that are carried by currents. What are the environmental issues, the health issues and health risks that are really coming from upstream or from different communities that, how has this impacted vulnerable communities just based on just the watershed flow? And then we're going to think a little bit about what are some of the actions and things, what does it look like to swim upstream? What are people doing? What does some of that action look like? And what are the options specifically for Indigenous peoples and communities? And so wanted to also think about if everything is connected through water, then the choices that our relatives make upstream impacts our livelihoods. And in the same manner that the choices we make impacts our relatives downstream. And so this gives us kind of just a point of reflection of what does it even mean to be a good relative? So I'm going to shift a little bit into some more of my background in sustainability rather than the water inequity, but I promise it's going to be a little bit connected. And I want to give an example of what I mean by the consequences carried by currents in the context of the term sustainability, which is a huge buzzword right now and one that's become so diluted and co-opted by industry to mean, from my perspective, just really means slightly better. Without really thought into what it actually means to claim sustainable practices or have a sustainable society. And so this is just a publication that I have every new student in my lab actually read as the first paper to get us kind of on the same page. And it brings 6 different aspects of what they call insufficient but necessary conditions to claim sustainability. And this is just going to be the first one I'm going to highlight, which is we have to consider the propagation of impacts across multiple scales. So if we think we're doing good, we also have to consider all of the consequences we might have just shifted outside of our spatial boundary or the system boundary that we set in our head. And this is kind of just goes back to that point that if everything's connected, then obviously we need to be thinking much more about than just wherever we draw the boundary in the way that we try to solve these issues. So some examples of just kind of shifting these consequences, I think if we think about carbon and water footprints, a lot of times we actually just see these processes just moving out of the spatial boundaries of interest. And a huge example of this is the development that they had within Los Angeles, where they really wanted to focus on what does it look like to clean up the smog going across the city. And really the solution that they came up with was they closed down power plants close to the urban areas, and then they just reopened them in rural and low income communities. And this has really developed these terms that now we actually have called sacrifice zones. So that's something that we really need to be considering. And although I'm giving that example from an air pollution point of view, we can also think about the many examples we have of this in water as well. So I'm going to give a couple case studies and thinking about Superfund sites. And I appreciate Dr. Ingram from really starting this conversation and all the work being done on uranium. I'm going to give another example as well here and then talk a little bit about the region where we currently live in New York as well. And so this one is around, if we think about the Gold King mine, this was up in Colorado, up in Silverton, which is actually through that whole area, just well-established hard rock mining sites in the Rocky Mountains. If you drive down I-70, even just like the names of the towns you drive by make it pretty obvious. If you go past Silverton, you hit Leadville, and kind of continue going. But these are abandoned sites that just really never addressed what this waste buildup looked like. And there were some examples that we talked about through the last 2 presentations where we thought about kind of the vulnerabilities of these sites just kind of leaching into groundwater or constantly leaking into other water sources. And so in this case, it was actually the EPA that was coming in to respond to some reports of some small seepage or minor leaks. And it was actually the EPA who ended up opening this entire waste site and over 3 million gallons of sludge with the main heavy metals of arsenic, mercury, and lead that ended up going into the, I think it was from Clear Creek to the Animas River, which goes into the larger, watershed of the San Juan River until it eventually merged with the Colorado River, and where it really first started to really dilute in terms of color and high concentration wasn't until Lake Powell. So if you think about that, it's one mistake that ended up impacting every community downstream. And that's one thing that we can think about with watersheds or any ecological service shed as well. And then how we started to see the remediation. And that's why I've asked a few questions around the day around like, how do we actually fix this? And it's a little concerning in the ways that we really first think about what it looks like to try to remedy these environmental injustices. And I actually remember from my family, the first kind of impact that the first immediate response I remember from the EPA was actually just shipping in tons of plastic water bottles, tons of tankers to just say, here's some water from different sources. And so again, just trying to shift not only the problem across spatial scales, but also just the solution. Well, why don't we just grab water from somewhere else and try to bring it in? And if we think about like where we're trying to end up as whether it's the goal of sustainability or just good public health, that's just not the right way that we should be thinking about these problems. And so now there's a delayed response that took a while to get up, and there's now some temporary water treatment plants along the rivers to try to think about how can we clean up and pull out some of these heavy metals. And I think what's also really interesting about this is the lawsuits finally settled in 2023 between actually Navajo Nation and the state of Arizona against the EPA. And so they're finally now settled. There's been different actual settlements of funding that has gone out as part of these lawsuits. But I think what's really telling of the perspective that the EPA had was actually on their website, where if you look up kind of the lawsuit settlements, the way that they address the settlements of the lawsuits was that these settlements will allow the EPA now to focus on its resources on addressing pollution, improving water quality in the Animas and San Juan rivers, rather than continuing to expend resources on litigation. And so what I think what's really interesting is that is like, we really messed up, but it was everyone else's fault for trying to hold us accountable, and we had to waste all of our resources to go through litigation, which just feels like another way of pointing fingers. And so the other site I want to talk about is a super fun site closer to where we are up at Cornell University. And so this is a community that I work with now. I have students from the Akwesasne Mohawk area at both the undergrad and graduate level, where we're thinking about all of the different ways that we have these tool belts and skills as environmental engineers, as environmental scientists, but what is really going to be the most useful to the community to help their own response. And so kind of the story that's here is there's a lot of industrialization starting in the early 1900s, probably even late 1800s in Akwesasne. And the three big, players here are the Alcoa, Reynolds Metals, and General Motors, which these were all very large scale aluminum production companies. And what really was the biggest issue with these was the concern of PCBs, or the polychlorinated biphenyls, which are known as just high risk carcinogenic chemical compounds, and been really interesting. And I guess so. These were compounds banned in 1976, but are still very, very present in this community. They've even done recent studies where someone went and just tested the tree bark and said how much of these chemicals in PCBs are known or is present in just the tree bark. And so if you think about that being pollution starting in the water, then it must be in the soil, and it's getting all the way into their plant life. And so that again comes back to this idea that we're all connected, but I think it's an aspect of water quality that we might glaze over when we think of health outcomes. But how does the lack of clean water impact indigenous food systems, food sovereignty, and their ability to just grow and their own healthy and local foods? I think I guess the other part I want to kind of really talk about is the responses in this case were dredging and capping. And so dredging was essentially, can we just try to scrape out these heavy sediments that contain these PCBs, these heavy metals, this contaminated sediment? Can we just try to pull it out? Essentially just thinking about a big shovel in the river. Can we pull it out and try to move it somewhere else? Which again, without remediation, you're just going to move it from the bottom of the river to a landfill site. And then their other option is capping. So they're just going to try to put more sediment across the top of it, maybe heavy sand, maybe another layer, where you're really just kind of trying to close and keep all that pollution in one area. The problem is there's a lot of other players here. It's not just a river that isn't being used, has no lifeways. And so it's a major shipping area. And so just the movement of ships actually, so some of the toxic areas that are on landfills, they're right in the shoreline. And because it was the cheapest way to move it from the water onto the landscape. But if you think about the ships that are coming in, they're creating these wakes that just kind of go in and out, pulling the water. And essentially what it's doing is almost like a syringe pulling in the contaminated waste that they just pulled out the bottom of the river and just putting it back into the water because of shipping, heavy shipping traffic, but also just very poor regulation of speed limits, boat control, and transportation law. And I think the other issue with the capping as well is we've had a lot, there's a huge flux of hydropower dams that are going upstream of Akwesasne, and that's already started the flooding of, I didn't write down the number, but I think it actually shows on this map where some of those orange sites are actually islands that are already being flooded, almost completely flooded, that are traditional homelands of the people because of the need to put some hydropower dams in the middle of the St. Lawrence River. To make things more complicated in terms of like the actual sociopolitical responses is, I think you can see it on the map. I'm kind of looking at the small version in the back, but there's it's right on the border. The St. Lawrence River is the border between New York and Canada. The Akwesasne people have federal regulated land in New York. They have it in Canada. They have it across the islands. And so when it comes to actually policy responses, they have a much bigger uphill battle trying to kind of compete with two different countries and federal governments, while also trying to try to claim some right to one of the biggest shipping seaways between the Great Lakes and the Atlantic Ocean. So this is it's a very interesting kind of site where these problems have been around for so long and just continue to keep getting worse and worse. And it's to a point where there's just so much distress from the community, farmers who are just kind of refusing to even farm there anymore. They're trying to figure out, how can we even test our soil, test our water? If we want to, how can we find the right places? Because it's so expensive to test for PCBs. So how do we know across these large seaways where we should be testing? How do we know the flow of the river and the hotspots? So that's just some of the questions that we're moving towards and working with. How do we control the dam and operate the dam? What's the real danger of these boats? Can we try to use hydrological models to think about the actual speed limits that would be safer? And what would be the impacts in terms of the actual operation? So lots of things kind of going over there of how we can respond. But I think the biggest thing is trying to get back, bringing that knowledge to the people. And Dr. Ingram really talked about that around disseminating the knowledge. And that's a huge part of what we're trying to do as well. Working mostly actually with one of their head librarians and archivists, and again, training students from the area, which is a great model that we've seen earlier this morning, really helps to try to think about the commitment that they have to the community. So just wanted to kind of give that background around kind of what are these consequences that we're actually talking about that are just kind of going downstream. And I want to kind of think about this as a chemical engineer that I was trained as, an environmental engineer, as a faculty member. We love our equations. So here's a very simple one, which is, as we have our increased pollutant exposure and a decreased access to healthcare, it's just going to continue to amplify these health inequities. So there's very clearly two parts of this equation that we can really start to think about how we address. How do we decrease pollutant exposure, and how do we increase this access to healthcare? And so I think it's a good reminder too to think of it's not just through the water, but these environmental injustices are attacking Indigenous communities through the waters, the skies, and the soil. And in most of these cases, it's industrial pollution and water that's coming from upstream, or in cases like uranium and Navajo Nation, it's tied really to a forced need for survival through industrialization, thinking about what do we need to do to bring either economic activity, or maybe wasn't really authorized in a good way to start with. So kind of going to shift gears and start thinking about what are we doing to have these, or what are we doing to address this? So I'm going to talk about injustice and core health issues that we see being carried across these waterways, and now shift again towards the challenging work that we have been doing, both successful and unsuccessful, that Indigenous communities and researchers are working on towards securing more just futures. And so the first example I'm going to give is again from the recent Supreme Court decision about Navajo Nation's protected access to water from the Colorado River. And again, not a lawyer, no training in law school, so I'm relying on the American Bar Association to give me the best the best update on what this really means. So I'm going to start with what NARF, the Native American Rights Fund, started with their statement after the result, which was, well, the court agreed tribal nations indeed have water rights under the Winters Doctrine. The court nevertheless concluded there was no obligation to take steps to secure or even identify the water needed for the reservation. And that was the front of their report that they posted. The U.S. cannot be held responsible for water rights, and it holds in trust. And so just quick background, the Winters Doctrine is law governing tribal rights waters that was first established in the case of Winters versus the United States. It was from 1908. And it was around the rights to the Milk River in Montana, and brought forth by the Fort Belknap Indian Reservation, which is it's actually the northern boundary of their land. And in that case, it's a similar story that we've seen, where in this case it was non-Indians upstream building the dams, the ditches, reservoirs, canals, and basically trying to save all the water they could to divert the river's waters for themselves in terms of irrigation and agricultural expansion. And this interrupted the flow of the river to the reservation and deprived the community to use its waters. And so the Supreme Court ruled actually in favor of Fort Belknap and ruled it essentially illegal to prevent the water from flowing downstream. What it did establish was that Indian treaties imply water rights needed to serve the purposes for which the reservations were created, and that those rights should supersede any later arising state law water rights. Oops, I clicked the wrong one. But however, what this decision also didn't do was clarify how tribes can access their water rights or claim and quantify the necessary flow for their well-being. So basically just said, it's there, but we have no responsibility to tell you how much or how it's going to be regulated at the federal level. And so, 115 years later, we get to the Navajo Nation decision, where it's the latest Supreme Court case that grapples with the scope and meaning of water rights that tribes reserved when we signed our treaties and were put onto these different lands. And so we got a good background from the previous two talks, really around kind of what are the needs of Navajo Nation when it comes to water. And it was very serious, and the numbers that we've seen, we're at over 30% of Navajos on the reservation lack running water. A lot of them travel great distance to collect, and the average Navajo member uses a lot less, I would say. The number I found was around 7 gallons per day, which is very striking compared to about 80 to 100 gallons that the average American uses in their household. And again, the result was the Supreme Court actually voted it was 5-4, with the majority finding that the 1868 treaty that formed the Navajo reservation did not really require the federal government to ensure the tribe had access to water, or defined what that meant to have access to water. So this is one of the, again, challenges, the sociopolitical challenges that we're kind of trying to face against when we're thinking about what does it look like to change these systems that we're living in. And so I want to also give kind of a different outcome and a successful example from across the Pacific, where our Indigenous relatives won a huge case in protecting the waters from colonial New Zealand. And this, what I think is really interesting, highlights a huge difference between fighting for the rights to water and the rights of water. And so for this, if you're not familiar, after 140 years of negotiation, this was the guardian title, that the Maori tribe wins recognition to the Whanganui River, meaning it must be treated as a living entity. And so this was the kind of quote that I pulled out of it is from the lead negotiator from the I'm going to try again, Whanganui people, where he said, we have fought to find an approximation in law so that all others can understand that from our perspective, treating the river as a living entity is the correct way to approach it. As an indivisible whole, instead of the traditional model for the last 100 years of treating it from a perspective of ownership and management. I think from the future, I'm going to let you all read it because I think it's bigger for you than it's for me in the back. But that photo is the river that they're talking about. And what's really, really interesting about this is the new status of this river actually means that if someone abuses or harmed it, now the law sees it as no differentiation between harming the tribe or harming the river, because they are one and the same. And that's that idea of that indivisibility between our environments and our own health is something that we can really, I want to keep pushing forward as we think as like a main takeaway from what I'm going to talk about throughout the rest of this, which is it's so interconnected. And so I don't know how to exactly translate that into the role of people that are here for kind of the training from a healthcare perspective, but it does talk about kind of the broader perspectives in which we need to understand human health and address it. So I'm going to talk a little bit about some of the global perspective and some of the experiences I've had on the global policy scale with the International Indigenous Peoples Forum on climate change. And so again, although these experiences were focused on Indigenous socio-political responses to climate policy, I think the lessons and applications are going to translate really well into this fight for equitable access to safe waterways. So I'm going to, again, try to think about, when I was thinking about what are the options that we even had for change as Indigenous peoples, what are the ways that we're trying to engage these systems? The first one I think that we have is engaging in policy and or research. And so that's what we're seeing here. And when we show up to the United Nations is what we see when we're trying to lead labs or learn as students and continue to think about what are the ways that we can use the institutionalized science to really address these issues. We also have this the ability to create visibility, think about advocation. How do we make these issues as well known as we can to make it so that other people also care about these injustices? And then we have just our inherent ability to practice our cultures and think about all the knowledge that we actually already have and continue to have between our cumulative knowledge as Indigenous peoples, but also from the teachers, our original teachers in the landscapes and the waterways. And then again, trying to think about how do we plan like local intervention and remediation projects. And I think that's what we've talked a lot about here today. And I think that's going to be further kind of what I continue to talk about, but I really want to make sure that we think about this as, equal perspectives as well to addressing these issues as important as creating the visibility and just even practicing our own cultures. So just a list that I kind of came up with after my last trip. I've worked, I don't know, at least a year for probably 6 or 7 years with this group. And so this was from a previous presentation I gave, but these were at that time reflected on what were the collective needs that we were asking for in terms of why were we even showing up to the UN as Indigenous peoples, what was really at stake. And I think the biggest things we were fighting for was, one, direct access to funding. The second being direct platforms for effective participation, right? So how do we even engage with these processes that have been very purposefully separated from us, not just as community members, but specifically as Indigenous peoples? The third being the recognition of Indigenous rights. So thinking about all of the work that we had in UNDRIP, or the United Nations Declaration for the Rights of Indigenous Peoples in 2007. All of that was this, this 20-year battle of trying to figure out what does it even mean to have Indigenous rights? How does it differ from human rights? And this is something we can dive deeper into later if you want to talk over lunch, or I'll give my contact information as well. But it's a huge part of this. What does it mean to have collective rights to place? The other huge one that you'll see, whether you're at the Permanent Forum on Indigenous Issues or climate talks, is really around what does it actually mean to give free, prior, and informed consent. So that's the acronym FPIC, but it's a huge part of this conversation in the sense of, if you're an industry coming in, or if you're bringing in other projects, what does it actually look like to actually communicate those risks in a way that actually that gives a fair way for the community to make the right decisions? And so that's something to really think about, and something we can think about as the room that we've seen with trained chemists, trained environmental scientists, engineers, healthcare practitioners. So what does it look like to get that information, that data, and communicate it effectively? And then the last being the protection from political and industrial powers, who again see this land as a commodity. And this is, I think, more particular to climate, but I think would also have interesting issues in water. We might be a little bit past this in terms of some of the issues we've talked about today, where we think about, in a lot of Indigenous communities, we protect a lot of the biodiversity in the land. We have some of the most undeveloped land at a global scale. And now we're at a point where we're understanding the value of undeveloped land. And so this was kind of this idea that we're going to now have a target on our backs and vulnerable through whether it's forests across the Amazon, whether it's through our own protections of what it looks like to keep the tundra and the ice frozen when it comes to kind of Sami traditions of hunting and their livelihoods. And again, I think there's going to be a similar fight when it comes to water and water access and quality. I think it came through the industrialization of it came through a much earlier here in Navajo Nation, as we're talking about today, in the sense of that type of I guess that type of being taken advantage of from these different powers is kind of already playing, and we're trying to figure out how do we remediate it. But I think it's a good reminder that there's still these powers in play that we need to keep in mind. So this is where I'm going to just kind of shift to my research for just a little bit. I will try not to be too boring, but it's really what we do in our perspectives as computational sustainable designers or engineers. And so what we really think about with the foundational questions of the research that we work on in my research group is, how do we think about the concept of sustainability, and how do we start to really truly propose sustainable practices? And so I've always approached this concept remembering kind of that first thing I said, which was everything's kind of connected and we're all connected through these waterways. And so this is this concept of can we as engineers develop these integrated systems and systems models and use tools like optimization and design to really understand the limits and the flaws of relying solely on just technology. And so how do we shift out of we're going to solve all of these issues through technological interventions? So we've been trying to, as much as we can, expand out from that approach to how do we include ecological systems, how do we include the roles of landscapes, all of the different uses and powers that ecological systems and ecosystems bring and provide for humans and human health, and then what is the role of social systems within that. We also very much understand our limitations as computational scientists. And so we really try to work as much as we can to engage with community voices, community partners. And I would say one of our biggest strategies of how we actually engage is trying to figure out what are the main concerns of the community and figure out how we can use our type of approaches to help them translate what they're already saying to policymakers, to industries, to really just help them translate their concerns into the language that of the decision makers that are really being imposed on them. And so thinking about it in this way, I also think it gives us as an idea, as again, coming from a background in chemical engineering, how would we even consider health risks meaningfully into this type of work? So I think, again, my main, I think, value of through this is kind of how do we break down those barriers of academic disciplines? How do we understand the value of investing in continued collaboration and the fluidity of knowledge as we think about these services for public good, and really not trying to hold on to as much as we do, which is that the standards of static practices, the goal of business being to maximize revenue. So trying to think about how can we be a little bit. And we've seen a lot of these disciplines start to shift in the way that we're thinking, but I think that's a big part of what we're trying to kind of do as well within our lab and show that we can do it in more from the perspective of engineering. So I'm just going to give two quick, I'm going to give a research example that we're working on in the sense of air pollution. One that's just basically just waiting for the last review in terms of publication to show kind of how we can use this type of work from in terms of ecological solutions, along with all the socio-political challenges that I've already talked about. And so this is this idea that we worked on within climate change, noting that there was this huge excitement for how do we invest in nature-based solutions to sequester carbon, to mitigate climate change, and yet we weren't really integrating it well within all of these other opportunities that forests and natural ecosystems were providing. So this was around focusing on spatial modeling and optimization so that we could actually minimize health risks associated with chemical plants in a certain region. But again, using the exact same goal. So if we were going to set aside this amount of money to plant this amount of trees, that we were going to measure how much carbon was being sequestered. we could do that in any plot of land that we decided was available. And so this was around looking at the actual spatial, where we did it could matter and completely change the outcome in terms of public health. And so that was the foundational question. Can we plant more trees to not only address carbon goals, but also address local health risks? And so this was kind of what we were able to come up with, which is if we can maximize our health benefits, we can increase ecological capacity. But this is that idea of, as engineers, can we go from an air pollution atmospheric transport model, connecting it with the actual chemical industry design of the facility in operation? Can we then map out to the atmospheric chemistry? So in one of the cases here, we talk about kind of the transformation of NO2 coming from a direct power plant or smokestack, how it transforms into ozone. Ozone puts forward, respiratory risks for breathing in and exposure. And then also thinking about, that's the health risk to humans, but then we also have these trees that have this ability to take in NO2 before it turns into ozone. There's more trade-offs and complexities that we can talk more about. But again, if we're already committed to just pay for these trees because of one way that we've defined sustainability, which is carbon sequestration, what are the other opportunities that we can get in terms of trying to maximize the different services and recognize all of the different benefits that we get from ecosystems? And so this was kind of just the difference between, if we were to look at the best arrangement, this is for just a case study over in Cincinnati. It was, let's put trees around the people, right, in the most urban areas where we're having the most health or the most human population exposure to these different the chemical hazards. And then also thinking about like just the differences of existing land use. They're just, we did so much industrialization. So some of the forests are going to be not the best place to try to continue our efforts in terms of managing this problem, but how can we really bring ecosystems to more urban and industrialized areas? And then we also compared it between like a best case and a worst case. And in terms of the way these models work, again, with pretty high uncertainty, and we can talk more about what that looks like from the epidemiological models, but it's the difference of, it would be almost around 99 mortalities avoided versus about 1. So it's that drastic in terms of how we can use ecological systems around us to help us mitigate some of these health risks. And so I just wanted to give a couple opportunities for improving water quality regulation. And again, trying to think about that creative way that we pitch these programs in terms, or these projects in terms of what are people caring about, and especially when we reduce these issues to one issue. So if it is carbon uptake, can we design and construct wetlands that also are going to have some sort of carbon uptake, but really can also think about the uptake it takes, whether it's most of the constructed wetlands that have been proposed at this point are for nitrogen and phosphorus runoff to prevent eutrophication into bigger waterways, helping kind of with fishing industry, with health issues as well onto the bigger water sources. And this is one a project I've been thinking about for a long time, but it hasn't really materialized at all. And I apologize if anyone's actually trying to read the results, but it's not really what I'm pitching. But this is around kind of how sunflowers and different plants can actually uptake heavy metals through just the growth of the plant itself. And so this was a study that was actually more focused on how could you reduce the uptake of heavy metals into the plant. So they were looking at using biochar to basically make more barricades that made it harder for heavy metals to transport into the sunflower. But you could also think of it as an opportunity to use that as well for mine remediation. You could think about it for any issue where we have those heavy metals sitting in our soil that might have a much worse impact on the people or the soil, the groundwater, than it would maybe within that specific flower or plant. And so what I thought was interesting about this approach and this study that was published last year was it was really trying to figure out how do we make sure that the sunflower seeds were safe to eat, which I think is a great study because it gives us a lot of information that we wouldn't do in our perspective as computationalists, but thinking about what are other creative strategies we have to actually think about using ecosystems for remediation of issues like, again, I don't know if this has ever been studied with uranium. This is mostly with arsenic and other heavy metals, but if those are issues that we have, then how can we think about using things like that as well? So again, I'm going to go into these takeaways for healthcare providers. I've been trying to think about look at the clock and make sure I think I'm about on time for for lunch. And you never want to be the speaker between lunch. So I'm just going to think about some of the takeaways for healthcare providers that I, again, thought through from a chemical engineering perspective. So they might be completely off, but this is my attempt. And the first being context specific training and dialogue to meet social and cultural informed care. I think that's kind of what we're doing here in part of this training, ongoing education, figuring out not just kind of what is healthcare practice, but what does that healthcare practice look like within that specific community and the people that you work with. This one, I apologize for the long text because I'm going to have to read this, but glad I put it in bold. Utilizing your community interface. So thinking about healthcare practice as this way that you're engaging with communities more face-to-face than researchers, than maybe in some cases, even some of the environmental agencies, where we think about that's an opportunity to communicate best practices, whether it's best practices for identifying safe drinking water, which I know the Navajo Nation EPA has published reports on this, or any other environmental risk mitigation strategies. What is the role that we can use through that interface with the community from healthcare providers that we can think about continuing on this education and providing this type of information to patients and community members. Then the last one is being around surveillance and reporting. So I guess the last one was more an idea of how, I guess how we can use all of this research and all this data to really think about healthcare practitioners as the ones that can translate this information and really get it out to communities better than probably we do, as we mentioned, as Dr. Ingram mentioned, just publishing it in a journal, right? No one's probably going to read that. So how do we make it accessible? But then the other part of it is how do we actually develop our own data from the healthcare perspective for monitoring and tracking health trends in regions that really can actually lead in the opposite way to identifying those environmental hazards that are already being exposed to populations. As far as, I added one more, I thought I was done. And I guess just my last point, which is because everything is connected, there are many strategies that we can take towards improving public health and environmental health, and remembering that it is indivisible, it's inseparable. So just kind of want to give that, I guess, last encouragement for this continued collaboration between scientists, researchers, whether we're environmental chemists, we're environmental engineers, chemical engineers, doctors, pharmacists, in terms of how we, connecting those different industries between the pharmaceutical production and again, the continued issues that could have on these other aspects of the community health. So mostly just encouraging this as a start for more and continued dialogue. So with that, I just want to say, thank you. And time for any questions as well.
So just with your work with and I can't remember the group that you said that you go off and, do more policy, or at least bringing attention. Anyway, like the court case that you talked about with the Navajo Nation and how strongly the political climate is. So I'm scared a little bit. So how do you see, you make progress and then things change. How do you keep that momentum going?
Yeah, that's a great question. I would say from my experience, one of the best things I've seen was from kind of the different balance in which we're pushing forward for the different changes. And so thinking about the different roles, whether it's coming from academics, whether it's coming from research, whether it's coming from young people with signs and banners who care about this, who's marching out this, who's making it vocal, who's making it visible. And then those that are sitting in the room in suits trying to really advocate for what are and I think about all the time I've spent out these UN within those halls, and the sense of you're bringing together, thousands of people around the world. The youth are coming together. There's this kind of beautiful collaboration that people are learning about the impacts from different communities all around the world. And you kind of take away more hope from the people that are just showing up and building those relationships. Even though you might be working, a lot of my work was working specifically on the policy too. And so I would go in for, I worked for 2 years on like one sentence essentially, and even longer on things that just got completely thrown to the wayside and take a few more years to bring back, when one of them was like a conflict of interest policy. Why do we have the people that are profiting the most off of these pollutants being the most visible in terms of these negotiations? How do we try to think about that? We did that within many other, the big example was the big tobacco industry and so we've had some wins, we've had some losses, but I think the biggest thing I feel like I took away was trying to think about, even though we might lose some of the policy ones, we're still building more and more relationships and hope within the community members, within people understanding these issues better and better every single day and being willing to fight for them. So I think that's where we keep the momentum going, is making sure people understand that what the Supreme Court case was that we lost, and seeing, is there any pressure? You think about even just what we're up against, right? We have 9 Supreme Court members where probably none of them were actually formally trained in Indian law, right? So that we are always going to be kind of swimming upstream or going against an uphill battle. But I think the more and more we can kind of balance and keep that momentum coming from different aspects, whether it's research, it's, our creativity, the storytelling of our youth, our elders, and the political wins that we can take along the way. Yeah. Sure.
So I'm coming from this firm. I work for water services.
Awesome.
So I'm located here from that perspective.
Okay.
Water. But in the question of something I've noticed, so for Navajo Nation, a lot of people who need to haul their water, they're using about 10 to 15 gallons per person per day. Obviously, they're amazing at conservation. Areas in the Navajo Nation that actually have access to running water, they're actually much more similar to Flagstaff, So having access to running water is incredibly important for people's health, of course. But with ease of access, people tend to waste it. So in the Southwest, how do we balance that? Any thoughts about that?
Yeah, that's a great question. I'm going to try not to go too deep into it, because I actually wrote that as a question for our panel coming right after lunch.
Okay.
Where that is, a very clear conflict, right? The more accessible it is, the easier it is to use, the more we're likely to use it because of convenience sake. And so I think, yeah, I guess from a broad perspective, I would say really thinking about the small public education that we do, building habits within, almost from training as young people, trying to remember what it looks like to be slightly inconvenienced. I think it's a process of remembering that. And I think that the more we teach about the bigger consequences and the broader issues, maybe the more we start to internalize that. We start to think about how it might impact, if it's impacting the way we're thinking, maybe it'll impact the way we act. Other than that, one of the things I always like to say is even when we're talking about these trying to come up with big solutions for climate change, I think one of the most practical things you can do is, start your day off and go out and just be barefoot in the land. I think that helps completely shift your relationship with how you think about these things. And so there's probably something similar there, right? What it looks like to go and be with the water, that could maybe change in terms of the spiritual aspect of it, or the way that we're thinking about it, which could in turn lead to that change in action. But again, I think there's plenty of other, a huge discussion to have, and I hope we're going to continue that after lunch as well.
So just to follow on with that, and I don't know if it's true, but I've heard talk about water policy, and that it's use it or lose it.
Mm-hmm.
And so I've heard people at the end of their talk say, just keep flushing your toilets, otherwise the state's going to give it up to California, which is so awful,
Yeah.
Right? But it's just the way things are written. So, let's fill our swimming pools, let's spray it over our golf courses, let's use it.
Yeah, and I remember a lot of data when the Supreme Court case came out too, around how even if there was, the rate at which Navajo could be given the rights up to, and trying to quantify that. And yeah, that was a big critique of it, was being underdone always. So why not give it to the people upstream? And again, I mean, we also structure our budgets like that. It makes no sense. It's just asking us to kind of waste more if we don't need it. But I don't have a good answer for how do we completely shift that infrastructure. But I think, yeah, it's an important part to note in terms of that practicality of what it looks like to how it's going to impact people in the next year for their budget or for their allocated water use.
We've got a question from online.
Okay.
Will we see changes in our lifetime in some of these policies? I hope
Great
so.
question.
I hope so.
I would say yes. Yes is I would say the short answer. Sometimes like the big ones are, people are going and advocating for 20, 30 years. I mean, one of the things I'm most grateful for and try to acknowledge as well is all of the work that like Indian country and indigenous people have done, since, the 1940s, 1950s, kind of really thinking about what does it look like to start interacting outside of our communities to try to better our communities. And so we're just kind of here in one moment standing on the shoulders of giants as well. And so I think, we think about the Declaration for the Rights of Indigenous People. That was a huge thing that happened that really enabled us to start to think about what does it look like to hold governments at a global level accountable. So in that sense, we're going to make big strides when it comes specifically to water policy, water use. I see it I think there's been such a shift, even just if you think about the society focus on sustainability, conservation, there's becoming such a shift from just the general commons that it's inevitable that we will start to figure out better ways within policy and structural changes in that sense. So my hypothesis would be yes, we will see changes. Sure, Tommy.
My question has to do with around some of the policy. You mentioned you worked on some of the policy. I mentioned that because since 2006, 2007, there's federal agencies that were involved with uranium mine cleanup, and even before then, there's like tribes or community members on Navajo Nation talking about water access. This has been ongoing for a long time.
Yeah.
And with some of the federal agencies that are involved with cleanup, and we used to have these huge stakeholder meetings, and this topic will come up, and it's still coming up. It's 2006 when I first heard about it, 2007, and it's like 2020, 2024. So a couple of weeks ago, we had this meeting with USCPA from Region 9, and they call it listening session as well. And there's many more that have happened in the past, and this same topic keeps coming up. It's like, we're listening to you. But to me, this has been going on for so long. It's like, are they really listening? Do they hear us? I mean, it's like if they were listening, then something would have been done about it. It would have been addressed, but it's not. And as a researcher looking at it, it's like this top-down approach is not working. It has to come from the bottom, because I say that because I do see like Dig Deep doing some awesome work and working with Talana Lake Enterprise. We did some great work as well. I'm doing some work myself trying to address water access as well. And Dr. Coletta Chiefs and her research team from University of Arizona is like Jani, which is a part of that as well. So do you from your perspectives, like how, like two questions, like in terms of federal agencies, like what would be the best approach for them to actually hear us, not just listen, but to actually hear us? And also the second question is like has to do with actually getting something done. It's like, from my opinion, I think it's from the bottom up approach, like from the grassroots perspective, and tackling this issue from the community with a partnership with them and addressing that. Do you see that from your perspective?
Yeah, so let me start with the second question, and then maybe it'll help me answer the first one. And I think you're absolutely right in the sense of the action comes from the bottom up, the grassroots organizations, the community members who care about changing something locally. I think the strategy of being able to show up and support bottom up efforts can pair with some top down, right? You can think about how do we get resources to those efforts? How do we make sure that there's no legal issues or accountability from bigger powers that might try to shut down different grassroots. How do we protect those grassroots and allow them to build? I think there's some roles from that top down. It's very tough to navigate, and I think, yeah, I think you're spot on. If you just show up, you probably they want to show that they're listening, but that to them that means having the meeting, not actually necessarily taking it into account. And so, yeah, it's a tough one, but I think there's some power too of what we're starting to see, which is specifically individuals going into those through those systems of power. I would say, kind of going into that those higher appointed positions. I think, and again, it's not going to ever be perfect, but I'm thinking about even just some of the ways the federal landscape has shifted just with the Deb Haaland in office, for say. And so I think there's power to that, where, again, it's going to be hard, I think, from my perspective. There's an indigenous educator, a philosopher that I actually have like one of his papers sitting printed out in my backpack that I read on the plane. So it's might be useful, might not be, because I'm just kind of wrestling with it too. But he kind of makes this claim that we're going to have people that essentially go through the colonial training, the literacy training to come do this. And that real change is going to come from individuals willing to take that on. The community change is going to be really difficult for, Navajo community members and those that are the closest into the culture and understand that way of thinking, to bring that whole knowledge system into shifting a political power or an educational institution. I think there's actually quite a bit of truth there. I wish you would see that change a lot quicker. But I think the way those systems are made up, that it kind of almost invites some of that individual perspective. So there might be some power. Again, this is just kind of thinking, maybe not, I'm trying not to say whether it's good or bad, but just kind of trying to synthesize this idea where communities can support individuals to kind of go through that training, go through those positions, and see, what does that commitment to community look like when they're there, and how, can we start shifting some of that power from that individual back to the communities. That's where I see most of the successes when it comes to the policy. That's how I feel like I was reflecting on that and kind of observing something similar. If you think about at a global scale, how are we building most of the power for indigenous communities globally? It's countries like Bolivia who have an indigenous president as the entire country, right? They're showing up representing, South America, Latin America, their country from that perspective as a community member. But the only reason they have power within the UN is because of that individual. So there's a huge issue with the power dynamics. It's just a big conflict between collective thinking versus individual thinking, and the way that we place power. So that's kind of to kind of try to answer that is there's all of the actual action and fast changes that we need are going to come from there. These structural changes may help give them more resources or may help support and protect those. And I think that's what you would see if you would ask most indigenous peoples at like UN things. That's what they're trying to do. How do we bring money to our communities? How do we protect them from these intergovernment political issues? So trying to go back, think about what the first question was. I in my head, it was going to tie together, but I've kind of lost what that first question is, but maybe we can start there and continue the dialogue, unless you remember it right now.
The first question was like, with these federal agencies like USCPA and issues about abandoned uranium as in remediation cleanup, but in that same context, people from the Navajo community has been talking about access to water or potable water for a very long time, like 2006, 2007, heard of their discussions. And 2024 now is like, just recently we had this meeting with UCPA, and the theme of their meeting was a listening sessions. Like, I want to hear what the community wants and needs, but a lot of the needs are redundant. What they've been asking has been redundant, and
that's right.
It seems like they say they're listening, but they don't hear us. It's just like, what would be in a much more effective approach and for them to hear us or hear from the community?
Yeah, I think, okay, yeah, I'm now remembering that, right, with the kind of just bringing the same thing back over and over and over again, year after year. I think in terms of effective ways, I mean, there's a lot of opportunity, I would say, in terms of trying to think around who can actually make that change. Is it just the EPA, or, you know, how does the EPA interplay into these other, I guess, governmental institutions and agencies? Trying to kind of figure out that network of how things kind of are connected in that sense can help figure out who's going to actually keep that, you know, if it's EPA Region 9 or whatever the specific agency is, who's going to help keep them accountable? Is there any way to try to, you know, help bring that conversation to others who might be willing to listen to help keep them accountable? I actually, the way I'm thinking of this question in a different way, that's more on my daily routine right now, which is thinking about if we want to make changes across like an institution, and trying to think about, can we identify those who that I think agree with us, but in a power that could help make more accountability. So, for example, in our institution, we have a dean who's been really gung-ho about, you know, how can we build better partnerships with like tribal colleges, bring in indigenous faculty, and how do we make, you know, we have one dean out of, you know, we have 7, 8, 9 colleges now. And so my approach and strategy has been, you know, for these smaller issues that might impact our current students or the funding that we get at the Indigenous Studies program, is, can I just keep going back to the same person even when I'm going to other people and they're saying no? Just be like, hey, this person was being kind of, you know, what's the perspective they're coming from, because it's really hard to get through this. And so if there's anyone that is willing to listen, I think is trying to make that an ally that can help try to keep the people that are having these listening sessions that keep falling flat more accountable. So I think that would be my one like piece of advice here, but maybe we can, as we chat more and more and have this dialogue, maybe more things will become a little bit more clear as strategies there. Well, great. Yeah, I've got the great opportunity to introduce this panel after our lunch today, where the theme and title is Bridging the Gap Between Water Injustices and Health Practices. So I'm just going to give a quick brief overview of the panelists, but then I'm going to have them introduce themselves and their work in the way that they would like to as well. So furthest down on my right is Sarah Roach, who's a family nurse practitioner and a doctorate of nurse practitioning student, a student at Ohio State University. I'm currently working over at Cayuga Family Medicine in Ithaca, New York. And then we have in the middle, Jonathan Credo, who's an MD PhD from Flagstaff University, or Flagstaff, Arizona, sorry, and is currently at the University of Arizona College of Medicine. And then we have Tommy Rock, the closest one to me, who's a research professor of sociology over at NAU. And I'll actually just kind of hand it over to you all to introduce yourselves the way you want to, and then maybe a little bit background on your work, so we just have a good idea of the expertise in the panel, and then we'll kind of dig into some questions, and hopefully we have some interaction engagement from those online as well. Start with you, Sarah.
I'm Sarah, like Michael said, family nurse practitioner at a small but growing community health system in upstate New York. I have been working for a little bit over a year, and it's been definitely trial by fire, learning a lot very quickly, and excited to be here. Speaking from kind of more the preventative side of medicine, I think of the speakers that we had this morning. If there was a call to any area in medicine, it would be kind of in my realm and sphere, because while noticing if there's any sort of contamination-based illness, while that is important, I think a call would be more, partnering with prevention, but also offering early detection and screening where we can.
Howdy, Yadesh, Jonathan Credo, Unisha. So good afternoon, everyone. My name is Jonathan, and just a point of correction. So I will be an MD PhD in about maybe 8 days now. So my PhD, thank you. So I got my PhD in 22 in clinical translational sciences, and I'll talk about that, what that means, because don't feel bad. It doesn't mean anything to me if it doesn't mean anything to you. And then MD will be, like I said, about 8 days. And then in about a month, I'll be starting a internal medicine psychiatry combined residency program at UC Davis in Sacramento, California. So in terms of my PhD, what does clinical translational sciences mean? I'm convinced it's part of that big alphabet soup where people just throw up acronyms to seem important. But essentially what I did is for the last, 14 years now, I've worked and collaborated with tribal, minority, and rural populations across Arizona and really across the Western United States for a short time, even internationally, looking at Australia and parts of the Middle East, but essentially looking at environmental contaminants and environmental exposures, and really trying to serve whatever that community's needs, essentially what they came to me for, or my collaborators. So ran the gambit from a relatively simple question such as, is compound X or compound Y in our air, water, food, soil, what have you, all the way to, we know that compound X or Y exists. Can you get us more money so we can try to remediate it? Can you get more attention from elected officials? Can something change and happen? And there's a lot of kind of intricacies that kind of determine what pathway that community takes and kind of what strategies you use. But that's what I've been doing for the last 14 years. More recently, given my medical training and kind of my, I guess, moving around in the medical realm and arena, it's been more towards education and advocacy, because I think a lot of my clinical colleagues, it's not that we necessarily, or they don't necessarily care. It's something that it's not environmental exposures, toxicology, that's not something really covered. And the emphasis in our training is more, it does not talk about that. So again, it's something you're asking clinicians to do something they have no experience, no familiarity with. So that's kind of where I've been moving towards with some of my research aspects and pursuits, although still working as the environmental analytical chemist, what I'm classically trained as. So that's just a little bit about myself.
Ja, det kan jag säga. Tommy Rockman shadow should on there. No dashing stunt the summer to see to the that shadow look at national day at and object Bishop on it just a team. Hi, my name is Dr. Tommy Rock. I am from Oljeto, Utah, and I'm a rookie professor, soon to be my first year to be over soon. And I'm in the ecosystem science and society, and I'm in an identity crisis right now. So I'm in sociology, applied indigenous studies, and I'm in ecosystem science and society. So maybe I'll find myself over the summer, see where I land. But I've been doing uranium exposure research and some of the stuff that I've been a part of, and I've been part of with Dr. Jani research and working along with Jonathan Credo collecting samples, sleeping out in the middle of nowhere and getting the wind blowing, and we got high dose of iron numerous times from the wind. And yeah, fun times. And starting to do research related to oil and gas as well, the gas exposure in some of the community. And Dr. Crudy and I are working on that. Hopefully it gets funded, so do more work around that area, which is a much needed area of study as well. There hasn't been any looking at the literature within indigenous population. And yeah, doing some more research on a band or around uranium exposure and uranium contaminant, and be looking at other contaminants as well. So I'm pretty excited to be here and doing work around water. But one of the main thing that I've done going to my PhD was to work with Native grassroots organization, and I'm still doing that. And I think it's a great partnership and collaboration, and I like that working with like-minded folks and helping make change happening, and I like that.
Awesome, thank you so much. So I'm going to try to ask a few targeted questions. You can hold on the mic, Tommy, because I'm actually going to start with you. But my goal is to try to kind of start with this idea of these water injustices, and then kind of as we rounded out really shift on towards solutions, whether it's from health practices, whether it or any other solutions that you see as the most relevant. But I kind of want to start with just kind of identifying the main issues. And so I'm going to start with you, Tommy, as it really connects to what we've talked about this morning within the legacy of the uranium industry. And so I guess from your perspective and expertise from, I guess, both uranium and maybe any insight as well from oil and gas, as you mentioned, that interest in as you introduced yourself. So what do you see as the top challenges for remediation of water and soil that will improve access to clean and safe water for Navajo Nation or any other communities? But
I think that addressing water contamination, I think a lot of that will be happening from the research, working with grassroots organization, addressing water contamination, looking at different water filtration system, different water filtration unit. And I know Dr. Kelly Chief and her research team in Digital Fuse are working on some of that, and I'm a part of that. And I know Jani Ingram's a part of that, and maybe Jonathan might be part of that as well. So that work is going on, but also addressing the water infrastructure portion of it. From what I've seen is that with the Safe Drinking Water Act and the water infrastructure, it really targets population density, and where the water lines are and where the water lines are being extended to. Those are where that's where the populations are. There might not be as much, but there are people that live in those areas, and there are more people coming back and moving to those communities as well. So the question remains, like, the people that live in isolated rural area, and those are the folks that are really preserving our way of life, our traditional knowledge, and practicing traditional ceremonies as well. Some of those folks are those folks that live out in isolated rural areas. Even with the lines being extended, and hearing this from tribal and federal regulatory folks, those lines will not extend to some of those communities or those areas. So there will still continue to be a gap. But I do think from the grassroots side, that bridge can be gap, working with community members and utilizing springs. Some of the project I'm working on is like I'm a part of a grassroots organization called Honor Water, where I work on springs and try to make water accessible, looking at water quality, taking water samples back and making sure that there's no elevated level of any of the heavy metals. So far, it's working very well. And I think doing that type of work is much needed to help bridge the gap of water accessibility and addressing potable water. I know that Dig Deep, they're doing that as well. And if there's another grassroots organization that are doing that, I'm not familiar with, but I know that's a way to help address the need for potable water, and ways to address water contaminants as well.
just a short follow-up. I was just kind of curious. Do you see different challenges in the cleanup of from your back, all the research that you've been part of on the uranium side? Is there any unique challenges if we look at any of the contaminants from oil and gas or even coal mining? Would there be any like major differences, or is it the remediation process is going to look similar?
It'll be different because with oil and gas, some of those test wells that were used to look at oil and see if there's oil there, some of those test wells are still in operation. There's water coming out. You can see some of the oil on top of that, and they're being utilized for irrigation purpose and for livestock as well. And then there's a concern about groundwater contamination from some of the fracking that's going on around Chaco Canyon as well, and from the oil and gas industry as well. So there'll be different ways of addressing the water contamination in those areas. And in terms of remediation of abandoned uranium mines, this came up about 2 weeks ago when we had this listening session with USCPA. My colleague, my friend Chris Schutte pointed this out, that if we look at the engineering of some of the materials, like the lining, some of those linings are not are not, they're not going to last that long. The durability of those materials are not long lasting. So the issue of groundwater contamination will still be an issue. And those are some discussions that are not discussed when we're talking about remediations. I think it's a good idea to have a lining, but in terms of ways to make it durable, making or finding material that will be long lasting, that can be pretty much effective. I haven't seen that or hear about that yet, but I'm pretty sure there's a material out there that can be used and utilized and address remediation in that sense. But the topic that we're talking about, a lot of that is applied to open pit mines. And some of the mines that are in underground mining, and they're like widespread, a web of them. And talking to some of the folks that are involved with some of the remediation of abandoned mines, like some of those are too hazardous to go in because of the mining collapsing. So in terms of addressing those and where those mines are, I think it's much more difficult with underground mining, just because you never know or the extent of how far they reach, how far they've been mined, and how deep they are, and how dangerous they are in terms of collapse as well. I think that's another issue that hasn't been discussed as well.
Thank you very much. I'm gonna ask the next one to Jonathan. And kind of interesting, kind of building on your background from the research of the analytical chemistry side, along with kind of your training in the medicals, your medical background. What do you see are the biggest obstacles that you think we're going to have, especially in this area of Arizona, or really any desert or drought vulnerable area? What are those? What's going to be that balance between consuming available water, even if it's going to be contaminated or have water quality issues, with kind of the health outcomes that we would expect from communities in this areas?
Yeah, sure. So that's a great question, and one I think, speaking at least to Dr. Rock and myself, is one that we've encountered essentially the whole time that we've worked with water quality in the Southwest, and really any community where water is, well, I would argue that water in any community is a precious commodity, but I think it's even more so here in the Southwest or drought-prone areas. And I think the difficult thing is essentially just a question you ask, is that at the end of the day, you can't have both sides of it. You can either have water or you can have no water, and it's a trade-off, one or the other. And that's essentially the conversation we've had amongst ourselves, amongst our other colleagues, and even with community members. And I think the community members put it best, when we say, we go out and present our research or our data, and they come back and say, like, well, that's all well and good, but are you telling me that I can't drink any water then? And so essentially it is exactly what you just said, Michael, that balancing act of, I can drink this water that's contaminated and die maybe in 10 years, maybe in 20 years, or maybe it doesn't affect me, but it affects my offspring. Or I can die in a week because I don't drink any water. So I think in those circumstances, I think for better or worse, really the conversation is like, as long as the water doesn't immediately, I guess, kill you or dramatically affect your mortality, that's the water you're going to have to drink, because that's what you have available. Dr. Rock mentioned how there's a lot of grassroots organizations, there's a lot of researchers out there that are trying to look at the filtration problems. And it's not just here in Arizona or in the Southwest. I mean, you can look at places like Bangladesh, across mainland Africa. They're all the same types of issues of, in Africa, it's e-recycling and metal pollution. In Bangladesh, I mean, we can look at UNICEF and the WHO. The largest accidental arsenic mass poisoning in the U.S. in human history happened. So I think one solution would be, filtration. How can we try to bridge or limit the amount of contaminants that are coming to human bodies? And if we're operating on that premise that you're going to have to drink water, whether it's contaminated or not, ideally not, but if it is contaminated, then I think the next best step would be to educate not just not just healthcare providers, but also the community members in terms of what to look out for. Because I don't know, I think a lot of people that I've talked to, they tend to look at healthcare providers essentially as all-knowing, as that learned friend, as Patch Adams, or Robert Williams said in Patch Adams, you know, that learned friend that knows what to do. But as I said in my introduction, the fact of the matter is that most times in medical education, we're not trained in terms of what are the subtle nuances of arsenic contamination or lead, chromium, mercury. I mean, I have a number of patients I've seen that have had arsenic, organic contaminants, TCE contaminants, uranium exposure. They all look different. And unless you have that training, you don't know what you're looking for. So I think providing that education again to the community for things to look out for, to say like, hey, your water is contaminated. If you're asking us to rank it, compound X is the worst, and you're likely to experience these type of things. Compound, you know, Y is next. These are the different things. And then again, have that same open conversation with healthcare providers, with the public health infrastructure and network in that area. So again, you can almost monitor that change in health. And I think, honestly, if maybe I'm a bit pessimistic, but unless things change, I think that's the same conversation we're going to be having, not just in drought-prone areas, but across the world. As populations increase, as our resources start to decrease and accessibility starts to decrease, that's going to be a hard conversation that we're going to have to start asking ourselves. So I guess that'll be my response to that.
Yeah, thank you so much. So we're going to shift a little bit now towards the kind of talking more about the experiences within healthcare and health practices. And so Sarah, I'm going to just kind of start by asking you, can you elaborate on some of the cases that you've seen in regard to environmental exposures in a broad sense, and pick whichever cases feel most relevant to you, and identify the challenges that exist in determining those root causes or healthcare responses?
In something that Dr. Credo has been mentioning is these subtle nuances aren't a part of kind of the baseline training that we receive. And I don't think it's the lack of providers wanting to be educated about these types of things. Like Michael had said in the start, the water is our predominant composition. So why wouldn't we be thinking of the water that we're putting into our body? And I think even participating in these types of discussions, there's can be that same tone of frustration, pessimism, and jadedness with the kind of constraints that we have to operate within. And so I honestly, speaking to a specific environmental exposure case, I don't know that I've ever encountered one that was, you know, the primary diagnosis that was on their discharge paperwork, or working in the ICU, years and years of a patient was just really, really sick and they got better and we gave them supportive care and they were healthy enough to leave the hospital without having any sort of formal diagnosis of what might have brought them in the door, just that they're better now. And I think a big part of it is because we remain very reactional in this industry. We don't put enough time, resources, and money into preventative care. And I try not to go on a tangent of this, but it's something I'm passionate about. From the basis, clinicians are incentivized to specialize. While specialty services are absolutely necessary, illness is what is expected in that realm, as opposed to wellness, which is a frame that we can kind of reach if we invest more in preventative services. So, but I don't know probably any PCP who has chosen to go into preventative care because of the money or the lifestyle. And it tends to come along with its same issues of reimbursement and compensation that continue to leave us under-resourced and understaffed, whatever the case may be. So challenging from that perspective. And I'm not I don't love public speaking, so I'm going to bring up my talking points here. But yeah, I think, after our talks today, it doesn't seem unrealistic that us as clinicians could have access by zip code what our patients are being exposed to, both what type of contaminants, but the concentration. And that would be incredible to have access to. What can I start screening these people for early, and not just waiting for it to show up as declining kidney function, which would that be a diagnosis of, contaminant-based kidney function or chronic kidney disease that we have to shuttle to a specialist? So I think that is the big thing, is that these things are possible, but they're not being involved into our sphere as well. And then from the other aspect is we continue to prioritize fee for service in healthcare. So that draws back to less prevention and more just utilization of more expensive services, specialized services. And I think that the biggest thing is while models are becoming more common that prioritize quality and the quality of care and the health of our patients, they're very hard to find, and it's predominantly compensation based on your productivity to the institution you're serving. So much more services to institutions as opposed to service to our patients. So while it seems pessimistic, like you had said earlier, unfortunately, we have the realistic truth that our health system is not structured to keep us healthy. And if we can just shift more to that preventative side, be less reactional, listen more to these great researchers and what they're bringing to the field. But I think the other big barrier and that is also discouraging is we know widely in medicine from early days of our training that it takes a very long time to get evidence such as the research we've listened to today to the bedside. That average is about 17 years. And I think that's predominantly within the silo of research that we create in medicine, not necessarily, I'm sure it's even longer is what I'm saying for kind of environmental research and the discussions that we've had today. And so I think in the preparation for this talk, I was trying to say, okay, I have a patient in front of me. They're asking me for, screening of contamination. That's very wide. There's the closest that I could find on our lab formulary was a heavy metals screening panel, which was predominantly just arsenic, lead, cadmium, and mercury. So nothing that we really kind of talked about today. Couldn't find anything for uranium. And then the PFAS also not present on lab formularies. We would have to utilize an outside lab source, and tends to be with insurance compensation. If you use an outside lab, are they going to want to cover it? And what is that expense going to be out of pocket for patients? And while things like lead are about $50 out of pocket, testing for things like PFAS from just a quick search was about $600-700 if you don't have access to a health department that has kind of partnered with an academic institution to provide those biometric screenings. And so I think that bringing those services more readily to us, or creating panels and screenings that could be of less cost, and then if anything is abnormal positive, reflexing it to something a little bit more higher level. But again, that's not something that's a part of our training now. And it's definitely not a part of the health systems that I'm operating within. As I was thinking about this, the best case that I could point to was how lead screening evolved in this country. Pointing back to before, it's predominantly reactional in medicine. It wasn't until a bunch of children were succumbing to or being treated for lead poisoning that we started regularly screening in pediatric patients. And while it is understood as best practice, as well as I know anything else that I've learned in healthcare, is that we should be screening children for lead. A lot of, at least in our school district, it's a part of their ability to get checked off with their annual well child visits, is making sure those lead screenings were done. But kind of to give you that timeline of soup to nuts preventative screening and getting that integrated enough into practice. It all kind of started around the US Surgeon General in 1971 saying we have a problem, a call for screening for lead, and particularly for those who are at highest risk. And to date, it remains a huge preventative healthcare problem for children. It wasn't until 1995 that the CDC actually started gathering data on lead screening being performed. And it's not a universal funding to make sure that kids get screened for lead. And as with too many other diseases, it disproportionately affects people of underserved and minority groups. So I think, and new movement in that usually has to come from horrible crises such as Flint, Michigan, to get a revitalization and diverting funds into these types of very important screening services. And lead is just a very common one at this point. But I would hate for it to get to the point where we have too many Navajo children succumbing to uranium or having, 80-year-old kidneys by the time that they're 30 for us to start regularly screening these people and these kids. And unfortunately, being in a minority population, it tends to fall below the radar. So I think while all that sounds discouraging, the evolution of lead screening came from collaborations between academics, clinicians, local and health departments, which is what we've tried to do today. So, and I think, but back to the second question, the only case that I could really pull from was actually one that evolved in the last couple of months as we were anticipating to this talk. And it was a guy nearing middle age, starting to think about his health problems, as a lot of us do once we near middle age. And entering in, he had been a welder for 30 plus years, definitely a known occupational exposure. Wanting to update a CT scan. He wants to know what his lungs look like. I want to know what his lungs look like, especially because he was like, I'm a welder. We didn't always adhere to, the OSHA requirements to doing our job. And so I tried to move it after a discussion. It seemed like a good decision in my mind to proceed with a low dose CT. That's what we do safely annually for patients who have a significant smoking history to screen for lung cancer. Because it's low dose, it's safe to do annually. And I was informed by our support staff, nope, can't do it without like a current cigarette smoker or somebody with a significant pack year history. We can't do a low dose CT in this setting. It has to be a cigarette smoker. So I said, okay, let's switch gears. Let's do a CT without contrast. It's not something that I would want to be exposing this guy every year to, but let's get an update on his lungs. With just a diagnosis code of occupational exposure, it was denied by the insurance companies, citing not enough evidence. Thankfully, from being able to dig through his chart and find a CT that was done in a brief emergency room visit, there was a finding of atelectasis, which is a very benign, reversible, commonly encountered pulmonary finding that can be reversed with pulmonary hygiene and deep breathing exercises versus pulmonary fibrosis, an occupational exposure consequence that could dramatically impact his health ongoing and his quality of life. So without that finding, which I couldn't say it was pulmonary fibrosis because that would technically be insurance fraud, but within nondescript lung finding, not otherwise specified kind of ICD code, we were finally able to get it moved forward. And sure enough, it was the early pulmonary fibrosis is now pulmonary fibrosis on his new CT that we were able to update. As far as what it looks like, I don't really have a guideline for when next screening would be appropriate, but that was something that would have been missed if kind of not operating a little bit more creatively in our space of healthcare, which can be hard as we are pressed to see more and more patients and have a little less time to deal on that kind of intimate level to create those solutions. So, long-winded, but I think I answered both.
Yeah, thank you very much. I think one of the great points that you made too is really around how reactive we are. And if you think about the same thing, that's really how almost any of these agencies have started up. The EPA is only a thing because of just response to such drastic pollution to a point where rivers just lit on fire. And so I think that's just such a very good point around how do we break that cycle in the way that we respond to things.
Yeah, and I think that reimburse in just the idea, usually if we don't have a US preventative task force guideline to drive higher level cost things like imaging, we just can't move it forward, even though while a CT scan is expensive, treatment of stage 2, 3, 4 lung cancer is much more expensive. So kind of policy around allowing clinicians to operate more within their role and less through the constraints of insurance.
Yeah. And so I'm gonna move back to Tommy, Dr. Rock, and I really appreciate the just differences of expertise in this panel, because it's going to allow us to jump around a lot, but I think in a very interesting way that will help you all keep your breath too, as you, I don't have to keep asking you in the follow-up, but just the amount of different perspectives we can get in these issues. And so the question I'm really fascinated about that you mentioned in your response to the first question, which was the vulnerability of those that are the closest to practicing their culture, being in the most rural areas of Navajo Nation, the ones that are least likely to receive any of the water access benefits from these initial projects. I'm curious around, from like your perspective and expertise within the community and as a Dene person yourself and knowledge of the culture, do you see any conflicts or hesitation between community members, family members, yourself, around like within that idea of rapid expansion of water infrastructure, including both the transmission, the heavy digging, the pipelines, the treatment plants across the community? And I want to also just tie it to that question that was brought up earlier around when we add that access, we have that convenience, and now we start to see that use also continue to rise. I'm curious if you have any thoughts around how that connects to some of the foundations of the traditional knowledge that you've mentioned that you work within your work.
Yeah, just somehow. No, I'm just joking. Yeah, it's for the water infrastructure. A lot of it has to do with the federal grant. As you know, federal grants, they're like particular about where the funding is spent. So in terms of expanding and not helping the rural isolated community folks, that's not around their main funding purpose. So that's why I like the idea of the grassroots organization, because there's no tribal bureaucracy that's involved, no one to stop them. I mean, nothing to hinder them from doing the work, really. So with the grassroots organization, they can go and tackle that and address that and get things done a lot quicker, more efficiently, and get the community involved and have this need for water there. But in terms of water accessibility and not realizing how important it is, because the people that live out there out in the middle of nowhere, they know the importance, they know how precious water is. So, and it goes back to Navajo traditional teaching about not to neglect or abuse water or any other of the natural environment. So that's a lot of teaching behind that in Navajo traditions. And for them to start abusing, then that goes against our traditional values, our way of doing things, and like traditional ecological knowledge or Navajo fundamental laws. And I think that's the part where I know our tribe, the Navajo Nation, talks about preserving our culture and our way of doing things and addressing that. It sounds good on paper, but in terms of applications such as this, it's not there. I don't see it. I haven't seen it. So I think that's another issue that needs to be addressed as well. But again, it's like I think the best for my personal view is I think the best approach has to come from the bottom up, not from the top down, because I think a lot of folks from the top side, from the tribal government side or federal government side, is like they don't see what's happening on the ground. They don't see it. I think they become distance from it. They don't have the empathy for the community members that live in those areas that are being impacted. But the researchers and the community members and grassroots organizations, they do see it. So that's why they create these nonprofit organizations to address and try to help improve the quality of life for the community members that live out in the middle of nowhere, and try to address that as well. So I think that's where a lot of great things are happening, great policies, ideas are coming about. So
yeah, and I appreciate that. And I think there's a lot of examples of that when it came to the COVID response too. And I wonder if you'd follow up a little bit with maybe some of the examples you saw of what was like the bureaucratic approach from the tribal government trying to address COVID or respond to COVID, and then what did the grassroots approach look like? If you have any thoughts on that, I think it could give us a good example of the mobilization of communities.
From what I've seen is that they tap into some of the water infrastructure, water lines, and tapped into that and made water accessible that way. But it was limited to like 5 gallons, and some of them had elevated level of contaminants. So they gave them like little tablets to address the water contamination. But from looking at it, it's like, I think it's like a band-aid on a bigger problem.
Mm-hmm.
And for the reservations, like they're not only getting water for themselves, but they're also getting water for the livestock as well. So 5 gallons is not going to last that long. And the other thing too is we have these water infrastructures and we have these regulated watering points, but during the summer when the demand is so high, it puts a lot of stress on the public water infrastructure. They have to turn these regulated watering points off. When that happens, and people go back to some of these unregulated watering points that they used to go to, and it's not really addressed, it's not really solved, so to speak. So this summer, you'll probably see that. It's like you probably see a long line of people in a regulated watering point, and then at some point, they have to turn that off. And the other thing that I've noticed is like there's a limit of how much water they can get, and for whom, like for themselves, for human consumption, or for livestock. If they're for livestock, they can't go to those regulated watering points. They go to windmills or what have you if there's some around them. And from what I've seen from the grassroots side is like for some stuff that I've done is like inside the Treble Park, there are 3 springs, and it just one of the pipe just needed to replace. So I replaced those pipe and put a big tank in, and look at the water quality. The water quality was good, and then was already in use. It was usable, and some of the elders that used to live in those areas were using it. And another place too is like for Tulana Lake Enterprise, we got some funding from the Navajo Nation government to try to address the need for water, and Tulana Lake Enterprise drilled six wells, I believe, along the Little Colorado River, and the water quality was good enough that people can use those. And for Dig Deep, they're doing some great work providing water for the community members as well. And you didn't see all these bureaucracies, and you don't hear people saying, no, don't do this, or things like that. So I think that's a great way to address that, and more power to them, and hopefully they can go and gain traction and help bridge the gap of access to water and potable water with researchers from the academic side as well.
Yeah, thank you so much. I think it's just a great reminder of the importance of our relationships in our community and our ability to mobilize. So I'm gonna ask the next one to Dr. Credo around and I think what's interesting from the perspective too of the MD and PhD is seeing at least a few different sectors right in front of you, and then that opens up more and more as you just think about yourself as a citizen within these social systems. And so my question for you is around what are the disparities that exist across the communities in Arizona in terms of evaluating the water quality? I know we've talked about this a lot, so feel free to answer that how you want, but if that's not the exciting part to you, then I think the the exciting part could also be around where do you see the biggest opportunities for impacting change between different sectors, like policy, like providing economic resources, infrastructure, or healthcare training and healthcare response. So anywhere kind of along those the inequity of the water quality and how we're testing it, and even translating that knowledge to people, and then the where you see the most impactful solutions.
Yeah, sure. So in Arizona, in terms of water quality testing, I think one of the biggest or a significant inequity is just, I guess, what is covered and what is regulated, and what resources do people have, and kind of where did the different definitions fall out. So for Arizona Department of Environmental Quality, they have these. So when you compare the Safe Drinking Water Act, and the Safe Drinking Water Act is the baby brother of the Clean Water Act of 1970 and the amendments thereof. But the Safe Drinking Water Act is the one that essentially distinguishes, these are the contaminants that from a health perspective or from a regulatory perspective we care about, and these are the guidelines that we want to ideally be below under. If we're above that, we need to do something about that. That language is applicable to all the states if the states want to adopt it. If not, the states can enforce their own. And so Arizona Department of Environmental Quality uses their own language, which is essentially the same as the Safe Drinking Water Act. The problem is that those acts don't necessarily encapsulate the problems we're experiencing today, and they're not updated. So from context clues, it sounds like there's previous discussions about forever chemicals, so PFAS, PFOAs, and that whole group of the perfluoral family. That's certainly something that, 2 weeks ago, US EPA finally ruled there's seven of the hundreds out there that are actually going to be monitored and regulated. But coming closer back to Arizona, there's a lot on there that we don't regulate. Primarily, Dr. Rock has talked about oil and natural gas. That's not regulated. Down in Tucson, there's the trichloroethylene with the military sites, the historic contamination from 1952. Some of those compounds are regulated, others are not, even though they have very similar health effects. We can go all the way to Yuma, or we can go to Parker, Arizona, along the Colorado River agricultural corridor, and there, all the Colorado pollutants. So you can look at things like perchlorate, that's not regulated. Again, PFAS, again, rears its ugly head, that's not regulated. A lot of the agrochemicals are not regulated. And these are all things getting into water. And these are just kind of isolated communities, but it even affects communities that should be regulated. Let's look at Central Arizona, Prescott, Arizona, large arsenic and copper elevations above the Safe Drinking Water Act. But due to a variety of different factors, those aren't being affected. They're not being necessarily addressed. And there's also the disparity of the community that's essentially how they're, I guess you could say, reprimanded. So we know that Prescott, Central Arizona has a lot of arsenic copper issues, but we contrast that to Hopi Reservation, for example, also has a lot of arsenic issues. Why is it that the Hopis were fined a couple of thousands of dollars by the US EPA and Prescott was not? That's a whole nother question. So I think to answer the initial question that you posed, Michael, is where's the health or where's the inequity as it turns to water access and water testing, is the fact is the regulations that we're using is just antiquated, and it doesn't fit the needs that we have today. And trying to see the other side of the coin of, from the regulator's perspective, it makes sense. You can't regulate everything out there that may seem dangerous. You have to pick and choose your battles. And I think that kind of goes on to what Dr. Rock was saying, is that the larger the problem, the more people you have, bureaucracy inevitably comes into play, and you have to make sacrifices. You have to make decisions of what is I guess, essentially the pluralistic approach, what is going to help the most people and what is the most applicable. So unfortunately, the Southwest may have unique challenges and unique exposures that might not be the same as, say, the heartland of the US or the East Coast, closer to the flagpole. So our problems might not necessarily be the largest, most prominent problem in the United States. So I guess that's kind of a long-winded tangential response to the health or the water inequity testing. In terms of what could be done, what is the best, I guess, approach for this? I don't know. I guess I would lean towards education. And again, it's education at numerous levels. And my experience with this is just from the times that I've worked with Dr. Rock and other individuals on policy pieces with elected officials. If you provide education to the community, they are more aware of what's essentially happening to themselves, what's happening in their community, and they are able to, the voice of the community versus the voice of, one crazy, academic is, the community has more voice and more power than anything I could ever say. So if I can share my education and my knowledge and teach them what to look for, that's way more powerful. And they're able to share those kind of impassioned responses, those anecdotal stories, everything that Dr. Rock was talking about. And you're able to do it potentially in a way that isn't necessarily emotionally charged, because you can have these people who come up and almost just attack our elected officials and say, like, it's your fault, it's your problem. And it's all this negativity. And the moment you go on an offensive, you kind of just stop listening to that person because you're trying to defend yourself. And we can go on and on about that. The education from the elected officials, it also gives them the information that they need to make their decisions. So back to the example I was saying of when I worked with elected officials is, you have to look at things from a economics perspective. So, Sarah mentioned as well, when I've worked with elected officials, I essentially pose them of like, look, it's going to cost X amount of thousands of dollars for what we're proposing here. However, these predictions from numerous different parties also show if we don't do these aspects, these are the long-term health effects. These are the long-term consequences and what you're going to be potentially paying downstream, 5 years, 10 years, 50 years from now, what does that look like? And that seemed to be helpful and informative for the elected officials of essentially having a well thought out argument of a cogent narrative of here's the problem, here's what could happen, here's where the intervention can happen, and this is kind of the different scenarios you can choose to pick from. So you can pick and choose your battles, pick and choose your adventure. That seemed to be the most beneficial. And I think education at any level can be incredibly insightful and helpful because, again, you can take this to healthcare providers so they know how to advocate better. You can take this to educators so they can also teach their own students and teach the next generation of what to be concerning and what to look out for. So I think it's a very idealistic, but I think education would be the best way to approach it.
Yeah, thank you so much. I think the other theme that's really in what you just said too is that transparency, being transparent of what's those paths, what's that, how do we make decisions with that the transparency and then the community education. So thank you so much for that response.
I actually have a question, and I think it's best for you. As we've now, we're starting to make it mandatory to monitor PFOS, PFAS in our water. I know that as we were gearing up for today, those forever chemicals are also in our pharmaceuticals. And have you seen where, okay, now we've made it official for water. What does that look like for everything that we have on the market that might have these? Have you seen that at all? Because these are new things for me.
So I personally have not seen kind of in industry regulation or kind of like this downstream effect of it's now regulated in water. So how is that going to affect other industries? I have not seen that for PFAS or PFOAs thus far. And I think that's just because it literally was 2 weeks ago that EPA finally regulated, and that's opened a whole conversation of, how are we going to regulate what, we know we have the limits, but how are we going to enforce them? What's a timeline? There's all kinds of other things. Looking at other industries, I think presuming it will follow the same pathway of other industries. So I'm thinking things like the Clean Air Act in terms of auto emissions and how that kind of, what were the downstream effects, or even chlorofluorocarbons, I think would be another example of, we saw the environmental impact and how did that affect regulation. I think if research is able to clearly demonstrate almost like a catastrophic scenario like CFCs, I think regulation would be much, much quicker. So it was a very, CFCs was an excellent example of within 7 years, that regulation completely shifted in production and people stopped using it, from pesticides or even the auto manufacturing industry. I think the automotive industry is an excellent example. The Clean Air Act was also passed in 1970, numerous different amendments. The initial thought was that by 1987, 1988, most states should have those essentially regulations addressed. California, really the LA basin, had numerous extensions, and it wasn't until about 1996, 1997 that they were finally met. So they had an additional 10 years for a variety of different issues. So I think it again depends on where the research shows and what is the immediate health effect on humans, and really just on humans, because we don't really seem to care about the environment or animals or anything else. So how does it affect us specifically? I think that'll determine the speed and the rapidity that is going to be addressed.
Yeah, I think just to kind of add on to that, I think that we're going to see a huge shift in the water chemistry research, the people that are looking at this, because if you actually look at current PFAS studies, the majority of them is like around firefighting foams and training stations, because that's where we had a good example of really high concentration PFAS. And so trying to figure out where does that, if we're trying to study the transport, but I imagine after the announcement 2 weeks ago, we're going to see a huge shift towards the epidemiological focus and then the transport and interaction with the human body. So like you said, we're not going to take it seriously till it impacts human health and the money in our pockets. So I think we're going to see maybe a rapid shift in the studies, but that's going to take a long time for that to generate any evidence that's going to push that forward. So I appreciate that commentary. And I think too, kind of just to continue into trying to really connect this all back to the fact that we're here at the Flagstaff Medical Center, and tying all of this conversation back to healthcare practice. I'm going to kind of give my last targeted question to you, Sarah, as a nurse practitioner. Can you kind of talk a little bit about the main barriers that you see in translating these community dialogues or any available local environmental data into improved and more context-informed practice?
Yeah, and I think it's discouraging, but it's again the current culture and structure of our health system, and we wait too long for things, and I think that while it's mandatory that we maintain a certain level of CMEs to maintain our licensure. And so we are, placed in a position to always have continuing education to even maintain our license. So how can we use that less for things that you kind of just click through really quickly, and just to kind of get that check mark for maintaining your license into something a little bit more of forced dialogue, and getting people in a room to share their experiences, because I'm sure one of my colleagues has definitely had and you have had experiences treating people for toxicity of these types of contaminants. So I think that is the biggest barrier, and I think bureaucracy is kind of a theme here today of really even boots on the ground in healthcare. I think there is a very few percentage of people who enter into this industry without the primary motive of wanting to help people and care for people and make sure that we remain healthy. And so I think it's just as we keep saying, the more and more levels that we keep adding to try and make decisions brings too many voices and then things just grind to a halt. I mean, that's even prevalent in trying to enact something very small in our clinic. And so I think if we could just, the education, I agree with Dr. Credo, being more deliberate in our education and even just informing providers about things that are going on. I mean, I don't have any, we get updates from the New York State Department of Health that it's a predominance of like, we have our first polio case like in the country in upstate New York for a very long time. And so it's really just like disastrous things that we finally get brought to our radar from the health department. And so if we could, and it seems it just stays in kind of the public health world. And while we're practicing public health at a certain level, those kind of boots on the ground preventative things, it's hard to even point to what I can help patients get access to. If I don't know the answer, where do I get you that answer? So a part of those forced dialogues, bringing in people who can promote the resources that we have locally for our patients, so that we kind of have a toolkit to rely on if we can't ever operate within the constraints of our own office. Is there something that is getting funded that we can shuttle people towards, and to bridge the gap or create a stopgap until we have better policies to inform this. And but yeah, I think that enough people in a room discussing policy and change will bring about that, and making sure that it stays, that people remain under the thumb to make these types of decisions. So.
Awesome.
I was just going to add, because as you were saying, it reminded me. So Dr. Ingram, who spoke this morning, she and I were both recently, I guess a month ago at this point, in Australia at the World Indigenous Cancer Conference. And it just struck me that, you know, it was great to hear what our Indigenous brothers and sisters across the sea are doing, and the great leaps and bounds in terms of success that they've had in Australia, New Zealand, and Canada relative to the United States. But one theme that Dr. Ingram and I have seen at that conference, as well as a lot of conferences, is that the fact that information becomes siloed, and information becomes siloed in academics, in academic centers, and that can take a while to leak out to rural and to communities, as you mentioned earlier, Sarah. But also even within academics, information can become siloed. And I brought up WIC because there's all this great research, there's all this great epidemiology data, the public health departments are doing all these different things, but not one of them talked about bringing any of the providers to the table. And you ask them a couple questions, and it's a lot of them had the same response of, well, we just assume that they were busy. And if you're going to, it's hard to, you can get these people essentially in an echo chamber. And I don't mean anything bad about that. It's just, it can be hard to bust from that mold and try to reach out and have those uncomfortable conversations with other people, whether they're with the communities, whether they're with colleagues down the way. But I wonder how much of that will kind of help and address the stuff that you mentioned in terms of things will be ground to a halt because of so many barriers. So hopefully we can start collaborating more often with others to try to get those barriers broken down.
Awesome. I think that's a great point to kind of wrap up at least the questions I'm going to ask, but I'm going to kind of open it up, see if there's any questions from anyone here or from the Zoom.
I do have one. My background's in sustainability, and I thinking back like 15 years ago, they always talked about it like weak versus strong sustainability. And both Dr. Credo and Dr. Rock, you mentioned kind of technology and the filtration systems as a solution, which I imagine would help everywhere. It would kind of prevent some of these diseases from occurring. But how much is that more reactionary because infrastructure improvements they just can't happen? Or are filtration units the only type of technology that can be utilized? Or I'm trying to figure out, because I guess I should say it, I think water is a basic human right. And so the fact that there's this lack of infrastructure in these communities in the United States, it's baffling. And I know it is indigenous lands, but to me, that's just an excuse. So yeah, I'm curious. I'm going back and forth between the filtration units for technology versus just having infrastructure that will deliver clean, accessible water.
I think what I hear, I don't know the answer, but I think I hear in your question, like, we have a stopgap, we have a bridge of, these water filtration systems, but like, we can't let the stopgap be the solution, because the stopgap's not going to work forever. We're going to have, a filter that doesn't work for whatever we choose to put in the water down the road. So I don't know the answer, but I level with that question.
I think it'd be more of a reaction. And I think water filtration, there's improvement being made all the time with water filtration systems. So I think it's in long term, I think it's more sustainable, because with water infrastructure is like, as I mentioned before, it's not going to go and solve all the problems and having everybody on that water infrastructure. So the more economic solution will be water filtration systems, and looking at ways, or looking at which one will work, which one's more effective, and which one will work with what type of heavy metal. So looking at water quality, what the heavy metal things and PFOs, PFAs, there's more work to be done, more research to be done to get answers.
Yeah, I'm in kind of agree with Dr. Rock in the sense that I think ultimately where we are in terms of our technology, I think filtration is probably going to be, not only the short-term solution, but the long-term solution. So ideally filtration systems to catch the most concerning contaminants initially, and then that'll hopefully buy us enough time to think about the future. However, at the same time, you do bring a good point that for communities where there is no infrastructure, I think it's important to still have those, to think ahead before you essentially, drill baby drill. And I think, again, I mentioned it earlier, Bangladesh is an excellent example of this. 1972 to 1976, UNICEF, funded through the World Health Organization, went to Bangladesh and said, hey, you guys don't have enough clean water. Let's drill thousands of wells across the country. Sounds great on paper. However, if you drill far enough, you go down to the bedrock that has very high levels of arsenic. And suddenly now you've just poisoned the whole country. Well intentions, but again, it's the largest mass poisoning for arsenic in the world. Dr. Rock and I have seen very similar instances with the United States Public Health Service in terms of when they drilled wells on the Navajo Nation, and as well as other tribal communities. So I think it's also important to keep in mind that science, how do I want to put this? At least in academics, I think hydrology, geology, those kind of sciences can seem simple, and any problem, they may have a simple, there may be a simple solution, but you have to be cognizant of what are the variables that you're not considering. And again, like I said, the largest mass poisoning didn't have to have happened. Yeah, exactly. Yeah. Make sure it works. Exactly. Yes. Yes.
I also,
well, go ahead.
I was just going to make a comment around that as well, where I really appreciate that answer, where especially thinking about rural communities or even the sustainability of infrastructure, when we say that, we immediately think that infrastructure means built out from some central network where all of that is held, all of the power, the resources held somewhere, then distributed with costs determined, by whoever is managing it. I think one thing that's really interesting that we've thought about in the terms of electric grid expansion. So I'm going to shift gears a little bit just from some of our work and interests over there in the energy infrastructure transitions. And I think one thing we were talking about was the vulnerability of communities when there is like a blackout of electricity. And a lot of times they immediately assume it's whoever, you're vulnerable if you're prone to these blackouts. But I was making the case in this very large scale collaboration that a bunch of them are just all like energy grid infrastructure and electric network, like scientists. And I had to kind of counter in the sense of, it's actually probably the communities who are used to not having reliable electricity are going to be the most resilient to a blackout, where it's just, okay, back to this, we know how to live in this case. If you had a blackout for 12 hours in New York City and people didn't know how to heat in the winter, and they didn't know how to heat their apartment, that would be a much probably bigger issue, or I think, outcome of disruption in terms of vulnerability. And so I think that's something where we can think about the same thing with what is water, like small water scale infrastructures look like for rural communities, for individual households, that we can think about building out. Maybe it's still considered infrastructure, but very targeted use in the way that we think about that in terms of infrastructure. So I just wanted to share that point as well.
That's a good point. Just one observation from the conversations we've had today. All of the wells, the unregulated wells in the state of Arizona, are okay for livestock, but not okay for humans, but yet we eat the livestock. So is the FDA requiring any kind, that's a whole nother conversation, but are we checking our food for chemicals that we're now eating and ingesting and getting, medical effects from eating contaminated food? Because I would worry about people that, on the reservation, they raise their sheep, they, have the water, it's from an unregulated well, they butcher and eat that sheep. But is that also causing additional harm at different levels for cancers and other complications? So I think it's bigger. Water is absolutely the big issue, but it's not just for drinking. It's for our animals as well as human, consumption, to make sure that the meat is healthy and everything is healthy. The crops, the corn, all the things that we're growing are contaminated with those same chemicals. And so then we're getting, so it's a huge, huge issue. And I mean, I think I know our focus was kind of across the board, but also healthcare. What I see is this is a great opportunity to get people from different disciplines together, from grassroots up, but but I think you made the comment, you've got to know the right people that have the power to help move it forward, but creating, and maybe it's regional, statewide, task force or groups that can then bring evidence in to support good decision-making for those communities, but having the communities be part of that decision. So it's not Washington or even Phoenix saying, okay, this is how you're going to fix it. If you don't live in a community, you don't know the ins and out of that community. So it has to be in, community involvement, but it's, I think it's an exciting opportunity. And I mean, I've had so many research ideas coming through my head going, okay, we got all this data. We need to cross it with epidemiologic data. We need to look at, are there cancer clusters around and we may already have some of that data, but there's just a lot of work to be done and a lot of opportunity.
When I've seen the most palpable impact when discussing these types of things in healthcare spheres is just overlap of heat maps, collaborating different people's research. And I mean, with as much healthcare data as we generate, it's really not hard to develop that heat map for at least the health outcome side. So, and I know, I mean, it's just a level of common sense that if you kind of heat map where water access is the worst and you overlap that with different disease states, you're going to see that it all falls in those same areas. And
sorry to cut you off. Oh yeah, it's going to the healthcare portion of it. From what I've seen, what I've encountered is with some of the residencies that go into the IHS facilities, not only on Navajo but other tribal reservations. What I came across is some of these residencies that are coming in are not familiar with what they're practicing. They don't know some of the environmental contaminants that the Creedy knows because he's seen it. But other new incoming residents that are not familiar with, they don't know the type of exposure they're encountering. So I went and talked to some of the medical staff from Shiprock. I talked to some of the medical staff from Gallup, and they were not familiar with this type of discussions, the type of contaminants that are out there, like from water or from uranium or from what have you. So I think in terms of IHS facilities, I think you hit the nail right on the spot. It's a bigger issue, not just with water, but other issues as well. And I think from what I've seen from the medical side, is there's only like a very few select individual familiar with some of the contaminants in the areas that they're practicing. But in overall, bigger picture is like that's not always the case, especially in indigenous reservations. Dr. Credo?
Yeah, I mean, I'm just going to echo what Dr. Rock was saying. I mean, like you said, I've rotated at IHS facilities and clinical facilities all across the Southwest, and a lot of the time, they tap into residents and expertise and trainees that aren't from the Southwest. And unfortunately, I think giving them the benefit of the doubt, I think it's the culture of medicine. I think it's also stress, but it's very hierarchical. So why would you listen to a medical student who maybe he has worked for this problem for 13 years? He probably knows more than, say, you, even though you've been here for 2 weeks, but you are the doctor. So that can be a barrier to overcome, again, that hierarchy in medicine. And I think that's also in some places I've worked in, there's a conversation and question, I can't remember who it was addressed to, but this idea of how do you collaborate with the community? How do you bridge that? I think that can also be a barrier because, again, people that are siloed in the hospital, again, it's, you want to talk with your colleagues, you trust the opinion of the doctor down the way versus, the expert from the community. And there can be this perception that, well, if I talk to the community, they're not going to know what I'm talking about because I went to school and they didn't go to school. So I probably know more than them. And it's not uncommon to find an individual who has that mentality. And it's actually far rarer to find the person who's like, I went to a trade school for a couple years, and I'm willing to listen to other people who know more than I do. So I just wanted to echo that, and I wanted to say 2 other things. One from you, Michael, and then also to build on your comment. But for you, Michael, I was going to say, if you were looking for examples, I know the Northwest Portland Area Indian Health Board, Tom Becker Center up in Portland, I think 2 years ago, they actually did do a study that looked at, when the heat waves knocked out a lot of power in Portland, they looked at tribal communities, inner city, and then they kind of separated like inner city, another region, and then rural tribal communities, and showed how they looked at both absolute power disruptions, but also what did that mean disrupting their way of life. And it was, again, the rural communities were perfectly okay with it. Like, all right, we don't have power again, whatever. But it was the inner city people who they lost air conditioning, they lost like oxygen systems, they lost all these other things, and they were far more affected, even though, again, they should have all the safety nets. So if you're looking for a study to support your argument, there have been a couple.
Yeah, I appreciate that.
And the last comment I was going to say is you're 100% right of this idea that water is multifaceted. It's just step 1 of the building block. It's the primary introduction of the trophic level, and so many problems we know magnify as you go through trophic levels. If you look at it from a systems perspective, but if you're looking for real examples, I mean, I presume Dr. Ingram probably talked about this, but that's been a question the community has asked this for years now of, we know it's in our water, how is it getting to our food? How is it getting to our crops? So it's a question that has been asked by tribal communities, and Dr. Ingram and many of us are trying to answer that question as well. And I'm just reminded of when I first started working in Yuma, I was really interested in perchlorate. And when the people asked me like, oh, why do you care so much about crops if you're looking at perchlorate and it's in the water? And I said like, well, we know that perchlorate, which is another ubiquitous chemical, it's in all of our explosives, it's in our airbags, and it's in all these different things. We know perchlorate is water loving, and we know that Yuma is colloquially known as the lettuce capital of the world, and lettuce is about 80% water. Are you just assuming that perchlorate exactly, they see that 20% and it's like, oh, I'm not going to go to the 80% because this is 100% water. It 100% transfers over. And I think one barrier can be is that our systems right now are developed as very simplistic of, we look at, block A goes to block A, like it makes sense. The moment you have to have a deeper level of understanding of how does, biochemistry, how do these, lysosomal networks allow bio uptake of metals. I mean, Michael talked about in one of his presentations, China is really doing a lot of work on that. The moment we start asking that question, people drop off of like, oh, this is all assumptions. You're doing mathematical models to assume that a percentage is transferring over. that may be the case that 1% is transferring every minute, but there's thousands of minutes in a day. So you still have exceeded that threshold. So 100% you're correct.
Well, and I look back at COVID, you know, COVID affected every person on the globe. When we had that pandemic, all of a sudden, everybody was on the same page. We had to come up with ways to come up with more PPE, manage, you know, every aspect of that pandemic. To me, this is at that same level and should be elevated to that same level. So working with policy, working with our politicians, really getting this emphasis all the way up to make it a national emergency. Because I think sustainability and the changes that are happening with global climate change, it's going to make things worse because we're going to see more extreme weather. We're going to see more drought. We're going to see more water related issues, good and bad. But I think we're at that point. We need to say, okay, this is a crisis. It is a pandemic in itself, in indigenous, especially in indigenous and rural communities across the globe. It needs to be, again, one of those things that we elevate. I'm not sure how to get it there, but it's getting, you know, talking, you know, to leadership at every level and really, you know, lobbying at, you know, the highest levels to make this a priority, maybe at NIH, maybe, you know, different places to think about where we could say, okay, this is a priority. And it needs to be interdisciplinary, cross disciplines, not just healthcare, but it needs to be all of us together creating that solution.
And I think it ties back to the last thing you said in your presentation, Michael, was that it's inseparable. And kind of what you had been saying previously, Dr. Credo, is we're always focused on ourselves. And, you know, we engage with the environment every single day. And, you know, we drink water every single day. And even with the pharmaceuticals and questions, that's something we are informed, you know, and we consent to put that in our body. But something that I witnessed in the background today when I was just getting coffee was, you know, your guys' research is looking into where in sheep that uranium deposits and builds and what that would mean for your community. And I think that's kind of a unique perspective that underscores that this is an indigenous knowledge system, that you're actually applying it directly back to your community, which I don't feel like I see a lot in research. So, you know, overhearing, well, it concentrates in the kidney because the kidney is in the filter. So do we just educate the Navajo people who eat the whole animal not to eat the kidney? And, you know, and that direct tie back of you are doing that work and you're also boots on the ground, translating that easily to people who are, you know, actually directly impacted by that. And I don't see that in typical academic. I mean, my academic interaction is limited compared to others in this room, definitely. But I think that's something that I've not seen commonly done, is that actual direct translation. You know, you guys are at the nitty gritty of these very high level complex things that, you know, I'm struggling with, you know, years of higher education to understand as I'm bringing myself on board with this stuff today. But, you know, but translating that directly into the community that it serves. And I think that just emphasizes we need more Indigenous researchers.
All right. Well, thank you for that. I think at this point we can probably start to wrap up this panel and wrap up the programming, but I'm excited to continue these conversations because, again, we really just have started this dialogue. So yeah, thank you again to all of our panelists.
Excellent.
Yeah, you all can step on down if you want. But thank you. That way you're not blinded by the screen. Yeah, can we get the screen up with the last slide, please?
Excellent.
All right. Perfect. So folks, I want to just try to summarize what I think we heard today. You know, so as Dr. Charles reminded us, water is life. Access to safe water, it's not a privilege, but a right. And we're failing in many ways, particularly in our rural and tribal communities. Our best efforts are often through our scholars and agencies that are working in it. This time they're working largely independently, unless they coordinate efforts on their own. But our best efforts are when they work collaboratively. Research on water quality from scholars working with tribal nations to our own ADHS efforts for testing water provide information that we need to disseminate. We heard that today. Providing educational opportunities for healthcare providers is an important gap to bridge, while we also acknowledge how busy our providers are. We heard a call for us to support collaborative efforts of scholars like our speakers and panelists today, our healthcare providers, our policymakers, government representatives, and employees such as ADHS and ADEQ to try to remove these barriers. These barriers are largely social political challenges that present through billing hurdles, difficulty in sharing data across government and research agencies. All of these make partnerships with impactful and scalable solutions more challenging. Our solutions can't be Band-Aids. We heard that today on larger problems. They can't create greater problems, such as in Bangladesh. Or to move our problems by sacrificing our neighbors. We need local solutions, local interventions, and remediation that don't negatively impact our neighbors. We all rely on those rivers, and we've got to remember that we have neighbors both upstream and downstream of our own homes. So safe water, it's not going to get easier. We heard that today, but collaborative, community-involved, grassroots efforts, including conservation when we do have access, can have a sustained impact in spite of bureaucracy, hierarchy, and social political power struggles. So I want to say thank you to all our speakers, to our panelists. That was a fantastic conversation today. Please keep up the great work. For those online, if you would please fill out the, and for all of us, fill out the post-workshop survey. And yeah, thank you so much once again, and we hope to see you at an upcoming workshop.